Welcome to JustWannaQuilt, a research podcast coming out of Tulane University Law School, where we explore all kinds of things, stories about quilting, tools, field trips, maybe some famous quilters stop by, and, of course, a little bit of copyright thrown in just for fun. I'm Elizabeth Townsend-Guard, your host. I'm a law professor at Tulane University Law School. I also hold 2 fellowships right now, one at the Business School and one at the Newcomb Institute at Tulane. And I just want to quilt. Hi, this is Elizabeth. This is a special edition of the Just Wanna Quilt podcast. This is the audio recording from the Homemade Mask Virtual Summit held at Tulane University on Wednesday, June 17th, 2020. This is part 1. Part 2 happens on Saturday, June 20th, 2020. A quick word about the summit. The summit is about bringing sewists together with scientists to record what amazing things we did in creating all of the masks we did during the spring of 2020, and then understanding the science of how we go forward, how we make safer masks, how we help our communities. And so these are many conversations. We have over 55 panelists over 2 days, having what we see as sort of a patchwork of conversations, creating a quilt of conversations about masks. So it's about 4.5 hours long. There are lots of panels. You can pause it. I'm going to quickly tell you sort of the first half hour is our call to action, talking about how we all sort of began. There's also concurrently there is a chat going, but you won't see that obviously on the audio portion. We then go to the masks identified, which is kind of a quick basics of what masks are and what kinds of masks there were, and that lasts for about 10 minutes. Then we have mask mobilization, and mask mobilization are about 8 or 9 groups that are talking about how they mobilize volunteers to get the word out and to make the most amazing amount of masks we could ever imagine. Then we turn, that's about an hour as well. Then we turn to science and medicine, and we spend a good deal of time there. So first we have industrial hygienists. Those are people that help us keep our buildings safe, talking to us, and a scientist that's talking about the nature of the coronavirus. Then we talk to another doctor who on research on fabrics and what he's finding. And then finally we have our keynote speaker who's speaking on masks unmasked, the look behind the science of fabric masks, and suggests that the new World Health Organization study saying 3 layers includes at least 1 man-made layer of polypropylene or polyester. This lasts about an hour or so, and it's really worth a listen. Then we end with a little bit of conversation about sort of why we made masks, the culture of caring, and a little bit of the connection between what we do as sewists and why we care, and the current social justice protests and the Black Lives Matter movement. So I hope you enjoy this. It's a full 4.5 hours, and it's I found it very moving, and I don't know, I hope you like it. Part 2 is on Saturday. If you want to sign up, go to the JustWannaQuilt website, and it will give you a link. It's free. There's also a giveaway. So if you sign up, you can be entered into our giveaway, which we will draw on Monday. So here you go. Here's part 1 of the Homemade Mask Summit. It was sponsored by the Newcomb Institute at Tulane University and also co-hosted by the Phyllis M. Taylor Center for Social Innovation and Design Thinking, and as well as the Albert LePage Center for Entrepreneurship and Innovation at the Freeman School of Business. Thank you to all 3 organizations at Tulane for helping us. We couldn't have done it without you. Okay, so hi, welcome. And I'm so excited that we're having this summit. We've all been talking about all these issues for months now, and this gives us the opportunity to have a conversation together. I'm super, super psyched. This is the Homemade Mask Virtual Summit, And we are bringing together scientists and sewists and entrepreneurs and inventors and artists and costume makers and everyone you can imagine over the next 2 days and 10 hours of programming. We have almost 500 people registered, and I know a lot of the people are here. We are so appreciative of your time and being part of this. And we know that a lot of people are also going to listen after work or when their kids are sleeping or at other times, and we appreciate that. We have a couple of things. The audience is encouraged. You're not really audience, but officially audience. The audience is encouraged to participate in the chat. We have prompts with each session of we want you, this is part of the historical record. This will be part of what's going into the archive. So when we start to talk to panelists and we start to say, well, what was your experience? We would love for you also to put your experience in the chat. Because of the technology, we can't bring you online to be part of it on camera, but we can in the chat. There are questions and answers, so if you want to ask a question to the panelists. Oh, and Becky will be moderating the chat. So thank you, Becky. Super huge. She will post the prompts in all caps. There will be a new prompt, at least one new prompt for each session. We also will take breaks at the end of sessions. We just didn't put them in because it seemed to be easier and more fluid. Becky is our community partner. She is WeHaveMass.org co-founder and an alumni of Tulane University, who has been very much overseeing a lot of our technology, our marketing, and just being a whole lot of fun. Okay, second, if you have questions for the panel, put it in the Q&A. We have a crazy tight schedule, so we may get to them or may not. We'll see how it goes. Finally, thank you. Thank you for making masks, for giving up your own stash, for caring about others, for making masks. Thank you for being willing to learn about the science of masks here. And thank you for being part of this amazing community. If you're new to Just Wanna Quilt, you are now part of our quilting army. Our only rule is kindness, and we're so excited to be putting this on. Okay, last thing. So the summit is part of a larger project that is 4 parts. 1, the interviews. We've done interviews, and they're on our Just Wanna Quilt podcast. Number 2, the summit. That's this. Number 3, a preservation project. We'll be reaching out to all of you to participate so that you can tell your story, have video, have images of what you did, and that will be at the Newcomb Digital Archive, and we'll be working on that after the summit. And then finally, what's coming out of this is a best practices. So a lot of us, at least I felt this way, but a lot of us felt that we didn't have enough direction on like which fabric to use and which pattern is better and all of that. So we're working on that today. So that's it. That's what we're doing. So thanks again. We are going to start our first panel. And our first question to the chat.
Okay.
Yeah, go for it.
So our first panel, we're moving on to the story of how this all happened. So with Dr. Elizabeth Townsend-Gard, she's a professor of law, Page faculty fellow at the Freeman School of Business, and the Greenbaum Fellow at the Newcomb Institute. She's our director and leader throughout the next 2 days. Joining her on our first panel is Edith Gross, art quilter, long-arm quilter, and entrepreneur. Judy Walker, a New Orleans journalist and quilter, and Seth Hackler, who with Dr. Townsend-Gard started a million masks a day. Seth lives in Indiana and runs Quilting on a Budget Facebook group of over 40,000 members. And he started like Edith, Judy, and Elizabeth, quickly realized we all had to make masks. And finally, we have Tom Sherman, and she's a recent graduate of Tulane University who came on board to our efforts very early. This panel will last about 30 minutes, so let's turn it over to Elizabeth.
All right, and then for everyone here, just make sure you mute until you're talking because we'll hear background noises and that will be disturbing for people. Awesome. All right, so this should be a full, interesting conversation. We've got 25 minutes. Let's start. So let's start from the very beginning. For us, the very beginning starts March 11th. I'm going to tell my story super fast, which is on March 11th, we got notification that the Tulane was going online and that we were done, that the last classes would be in person on the 13th. Tall was part of that. Whitney was part of that. It was shocking and weird. Of course, Ron, my husband, and I panicked. We went to the grocery store. We bought so many things. We had like multiple carts, and everyone was looking at us like we were completely insane. Because we don't usually go to the grocery store, as Judy can attest. So on the way home, the NBA was closing, and it felt like the world was falling apart. by the 13th, we were all online. Last day of classes, students from the dorms were sent home on Saturday, and we started to have conversations. So I wanted to start, I think New Orleans is very symptomatic of what happened around the country, and particularly in hot spots. So we were under attack from the virus immediately, and it was scary and it was real, where in some parts of the country it came later. So I wanted to start with Edith, because Edith and I had conversations and we started to worry. And we started to think we needed to make masks. So again, we're going to do quick, this is just a patchwork conversation, but like 1 or 2 minutes, tell us like the beginning of how we were feeling at that time. And you have to unmute, Edith.
Thank you.
There we go.
Okay. Good morning, everyone. To be real kind of short, we were definitely nervous about everything that was coming across in the news. And we needed to find some kind of way that we could protect ourselves. And in the thought of protecting ourselves, it always expands to family. And then out from family, it goes to the extended family and friends. And so we thought, what better way to put our talents and skills to work than to sit down and actually start to craft some masks. And from that, we started to get into the problem of which one.
Exactly, which one. And you and I were freaking out. We were like testing them and freaking out, and we didn't know what to do. Seth, let's turn to you. Seth is a good friend. And you and I started to worry. By that next week, you and I were having conversations because and I imagine all of us, and I'm curious what you all in the chat, please tell us your stories as well, because I think this story is very similar. So tell us what was happening with you and me in terms of our level of panic early on.
Yeah, so when all this started, I tend to kind of be skeptical, not really over dramatic, I don't think. And I started looking at what was happening, like the timeline in other countries, and then started kind of piecing it together like, oh man, we're like in phase 1 here. And, you kind of seen like what was coming down the road, and everybody, saying, and then suddenly there was a mass shortage on legitimate PPE. And it got very worrisome because I have a bunch of neighbors and friends and stuff that I care about that are in that, group that are medically compromised. And so with you having your group and me.
Yeah, sorry. I'm just, And weren't we both seeing in our groups, like all kinds of sporadic things, and you and I were kind of freaking out because it was very hard to keep organized at that moment, right?
Yeah, so it was kind of like, you got your group and I got my group, and some people from each group were trying to do something. And then, I got one of your middle of the night Elizabeth brainstorm calls, and, you were like, why don't we put our groups together and like mobilize and do something? And, that was like an awesome idea. So that's kind of where you and I started, was like, hey, let's make a central hub of where everyone that wants to quilt or sew and make masks can go. And then anyone else that has information or wants to learn can go to the same place, and make it a centralized, educational, something.
Yeah. And you made a video.
Spread the word and mobilize people.
That's right. So this is super early on. So, and the university made a article about us, and that's how Tall got involved. So tell us a little bit about that.
Yeah, so when the university started posting about different outreach projects, I saw the Million Masks a Day Facebook page that you and Seth had made, and I reached out and we started outsourcing all of these different components of making masks, and we got this great team together, and it was a really successful project, and we did it in the span of a few weeks.
Right, and you applied, and I helped you to get money from the university to buy fabric, right?
Yes.
Awesome.
Yes.
We're going to turn to Judy and then back to Edith in just a minute. So Judy, you were out there. You were like, I stayed in I have not left my house since March 13th. But you're out in the world. So tell us a little bit about sort of the atmosphere here and sort of what was going on in those early days. And you need to unmute. It should be in the upper right-hand corner.
Can you hear me now?
Yes. Awesome.
Okay. So it was a very, very scary time because New Orleans was indeed a hot spot. I made some notes on the dates. I think that things happened, just for the record.
Awesome.
And I'm pretty sure, yeah. Well, and I was in touch with a lot of people at that time, and I follow a lot of social media stuff because I had to before I retired from being a journalist. So it was around March the 12th that I started seeing on Twitter these comments from people, and the hashtag that was, and I cannot find this hashtag, unfortunately, if anybody remembers it, it was something like make a mask or use a mask or something like that. And it made perfect sense to me because I had been out of town. I went to help a friend in early March, like the first week in March. And I had to fly on a plane, and I researched where's the safest place to sit on the plane. My friend was going to the hospital for cancer treatments, post-cancer treatments, and they had the big bags of things, the hats that crochet people had made. Okay, crocheters and knitters had made hats for the cancer patients. So they were just giving these things away. So I was sort of inspired by that as well. So I was asked by a friend of a friend to make some masks around that time for a doctor who was asking for them. And since I work one day a week at a quilt shop, I have tons of fabric. So by May 23rd.
March 23rd.
I'm sorry, March 23rd, I wrote down May, there was a story in the local paper that said hospitals were turning away the request for homemade masks, turning away the homemade masks that people were making for them. Now, the article also said some hospitals were accepting them. And as Seth mentioned, this was because there was a lack of PPE. And at the time, you will remember, there was CDC guidance said masks don't do a damn thing. And I know I mentioned to the quilt, and Penny Wyatt mentioned in that story, she was interviewed in that story, she's a Tulane person, and she likened the whole, that was the first reference I had seen in print of somebody equating the homemade mask movement to like America mobilizing, right. Women and people at home mobilizing. So she likened it to people knitting socks for World War I. Mm-hmm. So I definitely remember. So March 19th was the last day I worked at the quilt shop before the lockdown happened. And I had a conversation with the owner at the time. I'm like, people are starting to make these masks. Maybe you want to do a Facebook Live or something to say, here's how to make one. And by that time, the videos were starting to, pop up.
Seth made one of those. Seth made a video that got a huge amount of people watching it. She was resistant to the whole idea. Yeah. Because the CDC had said, you don't need to make a mask. That's right.
You don't need to wear a mask, save the N95s for health providers. So it was a very confusing and, I think all that chaos with the federal response to this pandemic, which has been well documented by this time, has sort of led to this whole thing we're in now where wearing a mask has become a political statement.
Yes.
Like, how does a virus get to be?
Right. Well, we'll talk about that as we go. So we're going to do that towards the end of the day.
Yeah, I'm just saying historically, I think
that's right. We're all in it together historically at the beginning. It was only when it got politicized later. Tal, real quick. So Tal, tell them a little bit about the grant you got and sort of what we were trying to do with the grant. And then we're going to go to Edith because to finish out the panel. We'll see if we have more time. But let's start with Tall.
Yeah, so Tulane had some community engagement grants, and we started to construct a project that would focus on outsourcing different components of what the mask could be. And at this point, I'm very new to this community, so I was trying to learn from all these different places, the kinds of things that you have to get, how to make it, the different types of masks, and we were still not sure if masks were even
and there was an opportunity to apply for a grant at Newcomb, which is where I'm a fellow and who is also sponsoring this event, which is so insanely great. And so you came to me and said, hey, I'd like to do this grant, and we worked on it. And so what happened?
And so we got this whole team together, and we successfully got a grant, and then we got an additional grant through the Taylor Center, which I think is also another sponsor of this event.
Another sponsor. It was very exciting, and you were a graduating senior, so it was so amazing that you were doing this with your time. All right, so there are two other people that we will be chatting with in the next hour, in the next session, which is Hailey and Whitney, who came on early as well. They are part of my team. Hailey, just really quick, and then we're going to we're going to Edith next. But Hailey, we'll talk about what we did late in just a second with Hailey and Whitney. They're my two law students, and they're beyond amazing. So we got this grant, and Edith and I are still talking pretty much every day about which one we should do, and should we do 2 layers or 5 layers or 3 layers? And I imagine for everyone in the chat, you were feeling the same way. I felt very lost and stressed out. So tell me, we got the grant. We got a ton of batik, because batik was like the new orange is the new black. It was the new thing. Everybody should use batik at that moment. And tell me a little bit about your experiences and what you did. We worked with you with the fabric and dissemination across the city on that fabric as well. So tell us a little bit about what this take us into the next phase of this. I need to unmute. Can you do it? There.
Okay, I can unmute. Okay, I thought you were asking Hailey.
Nope, you. No. So Edith, it's all you.
No, not me.
Yeah.
It's all you.
So all of the discussions, they kind of just bring in one more person and one more person. And so I met Hailey in one of those discussions. We kind of just did a Zoom like we're doing now. And that's when we came to the realization that the batik was the best product. And so that was at least a step in the right direction, I think, is when we started to narrow down different materials and fabrics and products so that we could feel that not just doing the work, but that the work was, we were being as efficient as we could be. So it was at that point that we started to realize also that we needed to kind of ramp it up and make things go a little bit faster. So as a long arm quilter, I started to look at another way that I could use my long arm machine and start to assemble the mask in probably a lot faster. So I was able to do the framework, and that is to actually install the fabric onto the long arm machine as if it was a quilt, and then sew up the sides and edges, so that I was able to maybe in about an hour or two.
Amazing.
I could make like 180 masks or something.
You're a maniac.
And then from there, then I counted on my quilting community to be able to pass these out as kits.
Yes.
And they could do the ties and put the finishing touches on.
That's right.
So from that, we were able to actually give a person 75 kits. And to think that one person could impact 75 people, and then another person could do another 100 and another. And
it was amazing. The other thing you all did was, because I know Pam and Joy are here, AccuQuilt created an Olsen mask, and we're going to talk about the different masks in the next session, but you also were able to help cut all of these out and then send them back to me. And so we were making many of these as well. So it was just the production, the ramp up of production happened in every way, and we're going to be talking more about that in just a second. Let's send it back to Seth. Now everybody's making masks. You made a video that was really popular. So tell us now, as we're in the kind of swing of it, what was happening, and then we're going to send it back to Judy after that.
So yeah, by this time, we started making masks, and I actually got my wife and my neighbor, David, and a couple of our other neighbors involved. And he had been in and out of the hospital because he's a cancer patient as well. And so he came over with his mask on, and he took it off, and he said, "Hey, let's take this apart, and I'm sure you can figure out how to make some of these." So that's initially how I started making masks, was by taking apart the the paper mask that you get from the hospital. And then as part of my group, I do videos. So I thought, why not make a video on how to do this, because other people are going to want to be joining in and doing things like that. So I ended up making just a quick tutorial in the very beginning. So it was the square pleated masks. And of course, we've learned, a lot easier ways and a lot more efficient and effective since then. But that video ended up, I think it's like 29 or 30,000 views, which, in the grand scheme of things isn't a whole lot. But, if you think possibly 30,000 people were able to see that video, and now 30,000 people are also making masks, or even half of that, 15,000 people are now, making masks. So that's pretty cool to think of, because now there's 15,000 people out there helping impact their own communities.
Insanely awesome. So we're doing a science. Hailey and I are doing a little sort of science tutorial next, and then we're doing a mobilization panel. But I also think that a lot of us were doing it in small groups, that we weren't a part of a big group. And I was part of Judy's troop. Judy and Joel, who you'll meet later, Judy would get an assignment, and we would all work on different parts of it. And Whitney was part of that too. She was cutting fabric, and so we had our own. Hey, Whitney, right? That was your first thing. Whitney was volunteered for her spring break, right? Yeah.
Yeah, I read about you in the Tulane Law newsletter, and then I was like reading just more and more about the coronavirus, and I was like, oh my God, first responders, essential workers, they need help. And then I just reached out, and you're like, can you cut fabric?
Right, exactly. For both Edith and Judy, you cut fabric. And then I would do other parts of it too. So everybody was making these little masks, little bits of the mask. And you got sucked in this crazy way. Now you're running this whole show today.
Yeah, it really snowballed, but in a really great way.
Oh,
in a really great way.
You're like, I should have never emailed Professor Townsend-Gard. So Judy, tell us a little bit about the people that we were helping first. We were doing journalists and pediatric. Tell us who we were in our first beginning.
Right.
Yeah.
Well, one of the things we did was I was worried about the photographers in particular at the local newspaper because, journalists can report over the phone, but the photographers have to go out and take actual pictures of people. So sure enough, they needed masks. And so I asked, and they said, they would take 80. So you and Joel helped me make those, and that was great. And then we were making them for an immigrant community that has a Tulane collection,
right?
And they also needed pediatric masks.
That's right.
And so we were all making like adult as well as children's masks.
That's right.
So that was two of the larger groups that we helped at that time. And then they also, some of the other ones, I was just making them for smaller groups, but those were two of the particular ones.
And I imagine that all of you that are in the chat, I'm watching the chat, it's amazing. Your stories are amazing. Seriously, I am so, seriously, it's amazing. So we all started also making them for our friends and family and sending it to them. And I don't know if all of you had this experience, but we connected back to family and friends, high school friends, elementary school friends, family. And then to have them send pictures or post pictures on Facebook with their masks on was like the most amazing thing. And sort of, right? And what?
Right. Our neighbors.
And our neighbors and our kids' teachers and just the people that that were asking for masks during this period of time, March, April. We were really it brought a community together. It was really beautiful. We'll talk about what happened later. We're not going to get into that yet, of sort of the politicalization that's at the end of the day. But for this beginning, Judy.
I just have one more comment. To me, this is another historical note that was really interesting, was how many sewing machines came out of the woodwork.
That's true.
I heard story after story of people getting their vintage sewing machine, their mother's sewing machine. One person just commented put in the comments she went and got her mother's machine. I heard this over and over again. People got a sewing machine from wherever and started sewing. And this has been verified at the quilt shop. The quilt shop never did really close because the owner had to go there and take in her mail and deliveries, the fabric she'd ordered. People came by, kept the quilt shop selling so much fabric to make masks.
Yes.
It was incredible.
We have heard that from Joanne. They came on the show. We've heard this from the sewing, there's no sewing machines. It's just been this amazing thing. Well,
I was part of a group here in Indy, and I thought what was neat was this Facebook group. I think it's called Indy Sewing Masks, and it was like a reoccurring post. There was like 2 or 3 machines that somebody had donated them. I don't have time to make masks, but if somebody needs a sewing machine, and it was kind of cool because it was like these couple of sewing machines now were like traveling around town.
Amazing. And
somebody would use it, make masks until they were burnt out. And then it was like, okay, who's next on the list? Right. And then, you would hear the story of these machines. 1 minute it's on the west side, and then that person's made 50 or 60. And then now it's, somewhere else. So, that was kind of a, I don't think normally us quilters would just willy-nilly lend our machines out, but in the spirit of everyone's willingness to give and stuff, to me that's even a really big thing. Being quilters, you guys understand, don't touch my machine,
right?
And for people to be willing to just loan it out to strangers for the cause, that's pretty special.
Well, I saw that.
Well, we have 1 minute left. Do you want to take us 30-second comment, Judy, and then we'll move on.
Okay. Well, I also turned to Nextdoor, the social app Nextdoor, and I saw that over and over again, Seth. People would say, I don't want to make masks, but I have an old machine I'll give to people.
Mm-hmm.
Right.
So
our story, our little story here is very familiar to people, and we see it in the chat. It's amazing. New Orleans was an early epicenter, and we were a city that knows a lot about disasters. We knew people who were sick, who died, and the world was coming apart. No one was untouched in our city. We are a caring city, and so we got to work. And you sort of see this as an example. And I see Seth is kind of like our I know you're not in New Orleans, but I feel like you are. So we drove, we did all kinds of things. We dove in, we saw it as terrifying, serious, and we as sewists and quilters had to pitch in a call to action. So this conference is about that, preserving the past, what we did and what we learned this spring, and also preparing for the future. I see our panelists already here. I am so beyond excited that you're here early to be part of this. And what I'm most excited about today is talking to the scientists. And I see Dr. Wilson is here and Dr. Rando is here, and I'm sure others because I can't quite see everybody. But we are going to be talking about the intersections of science and masks, because as quilters and as sewists, we had a situation we were like, what do we sew? And so we really had to think about it and look at the science. And then I got even more scared because my doctor was like, well, you personally should never go out without a mask ever. And so I was like, well, I need to know which mask. So that's why we're here, is because it's all sort of selfish. Like, I want to know what mask to wear and what mask to wear with my family and my friends, and to make sure it's all okay. So that is what our day is about. Thank you, panelists. Thank you, friends.
Thank you.
This is So huge. And I adore you all so much. Can you try? Thank you. Seriously, you're gonna make me cry. I'm gonna be crying all day.
Thank you all.
Thank you.
Thank you. Can you try to mute and undo?
Yes.
And if you turn off your mute and turn off your video, you should be no longer a panel.
All right. Thanks, guys. Have a good one.
Awesome. Thank you so much. All right. Up next is Hailey, and Whitney's always on.
Hi.
Hey. Okay. So we're going to do a little slideshow, a little PowerPoint about what happened with the mask, a historical, like which mask, how we should make it, what we should do. Before we do that, I want to say, before we move to our next panel, we want to do a super shout out to AccuQuilt, who donated to our Thank You Sew Us, who also donated a machine to us to help us with our New Orleans project to get as many masks out to New Orleans and our community, and we're very, very, very grateful. They are giving away a AccuQuilt Go system. The best. And so it's so insanely cool. We'll be talking with Pam Heller and Joy Banfield tomorrow to tell the story of AccuQuilt. And they have raised more than $100,000 that they're donating to No Hungry Kid. It is an amazing story of what AccuQuilt did as a company, and we are so proud and excited that they're here listening today, and also that we are talking to them on a one-on-one session about the AccuQuilt story. So we wanted to do a quick shout out to them as we go into this next panel. All right. Question for the chat. What kind of mask did you sew? What kind of mask did you wear? Did you include a filter or a filter pocket? And did it change over time? So Becky's going to be posting that in the chat. All right, take it away. Oh, that's me. Sorry. We have a script. I didn't know. Sorry. Okay, so this summit is personal. I made a lot of masks. I worried about whether they were good enough all the time. I kept making them. Then I started to see the science, and I felt like I needed to know more. I did a lot of interviews. We did 75 interviews for the on this project. We asked somebody needs to mute.
I'm sorry, I shouldn't be in.
Yeah. We asked scientists. We asked medical people. And so now we're here looking at this. Whitney.
Yeah, so now we'll turn to Hailey Barnett. She's a recent grad of Tulane Law School and now studying for the Louisiana bar, which is incredible because she's helped us plan this whole thing while studying for the bar.
Seriously.
Thank you.
Hailey, working with Dr. Townsend Guard, kept up with the research on mask types and the science behind the masks. So before we really begin, we'll have Hailey review the basic types of masks. This should be about 10 minutes.
Thank you, Whitney, and thank you, Dr. Townsend Guard. It's been such a pleasure to be able to work on this project. So I got involved because I was signed up to do some directed research through the law school. It was my last semester, and I needed to write a huge paper, and I was like, well, what am I going to do? And Dr. Townsend Guard was my faculty advisor, and she was like, we are really starting to see the emergence of what makes the best mask and what is going to, because we had seen a lot of people doing vacuum bags and all these other types of DIY things. And so I started to look at the different types of masks. I've been seeing N95 surgical masks, and I started to look at the types of masks and the fabrics that people were using and what fabric's going to be best going forward. Because that's the big question is, what kind of mask do I need to make and what materials are going to be best? So I have a little slideshow, and I'm going to share my screen here. Give me one moment.
And this slideshow will be available. We will post it so that you can have it. We'll give you a link, or we'll send it to you in an email so that you have it as well. And basically, it's going to go through a bunch of stuff. We're going to do it. There we go. Awesome. Yes. And thanks to Becky for making it beautiful. You really did. It's just very pretty. Super pretty. All right.
Yes. So a myriad of masks, the different face mask types. So there's a lot of confusion, like we said, in March 2020 about, do we wear one? Who wears one? What is the best one to wear? And it came out on April 3rd, 2020, that the Centers for Disease Control was recommending that all people, no matter how sick or healthy, was to wear a face covering when social distancing was just not possible. So when you're at the grocery store, or when you're walking in the park and everybody else is trying to walk and get their exercise in too. And like I said, there were a lot of mixed messages. The Surgeon General even tweeted out to people to stop buying masks. And that's actually kind of what contributed to the panic. People were stockpiling the N95 masks, the medical grade surgical masks. And that's why the doctors and nurses and other people in the healthcare community were facing a shortage of proper PPE. So now let's fast forward to June. We know that we all need to wear a face covering pretty much every time we step outside, no matter where we are. When we're out in public, I saw something that said, my mask that I wear protects you, and the mask that you wear protects me. So these are the most common types of masks. And the first one that I'm going to outline is, the N95 mask. So this is the one that everybody is saying is the best. It can filter out at least 95% of very small particles. They were the first one that people really started stockpiling because they are the best. They are recommended for use by doctors who are working directly with patients who have respiratory issues, and they're made of polypropylene. They usually have elastic ties, and like I said, they need to be prioritized for use by healthcare professionals. And when worn properly, there's a tight seal so that particles cannot get in or out of the mask. And then there's the surgical mask. Seth said in the previous panel that he started making these. It's going to be on the bottom right is your typical fabric surgical mask, and then top right is the medical grade surgical mask. And they can come with either elastic ties or fabric ties that you can just tie in the back. And it was the Deaconess pattern, which is seen, like I said, at the bottom right, that quickly became a popular mask pattern for sewists and quilters who started making their own. The pleats, in my research, I found that the pleats really make for ease of use and are really adaptable for anyone of any face size to wear. So that's kind of why they are preferred. Of course, any mask or any face covering is going to be better than none at all. But the pleats really are just provide ease of use and can help, can just help anyone wear them.
And then, Hailey, just to let you know, we need to move on the next couple. We got to go super fast so we don't get behind. So.
Okay. So then there's the Olsen mask, which is what a lot of people started making initially. It was put out by Unity Point Health in Iowa. Right. And, Dr. Townsend-Gard has one, if you'll direct your attention to her.
Yep.
So they are kind of, it's made in two pieces, and it's meant to create a tight fit over the nose and mouth. However, because they don't have the pleats, they lack the adjustability, so they're not as one size fits all. And they do require more cutting than a surgical mask does. That's one thing that I found. But after people started voicing their complaints, AccuQuilt came out with an Olsen mask dye cutter, which I thought was super cool. They were really on the cutting edge. And like I said, I guess it's more of a stylish type of mask as opposed to the surgical mask. And so now batik fabrics, yay. So like I said, I had been doing research about what type of fabric is best. People were using whatever was in their stash. People were using bed sheets. People were just using whatever they could get their hands on. And then in early April, a New York Times article was released that outlines the best kind of fabrics for homemade mask makers to use. There was a study done by Dr. Scott Segal, and he'll be on later today, out of Wake Forest about the filtration rate of homemade masks. And he found that the batik fabric in his study performs the best because they are tightly woven and they have a denser thread count. So they may be stiffer, which would ordinarily be a downside, but because they're stiffer, it filters the mask, it filters the particles better, and the tight weave just makes it ideal. So you do 2 layers of the batik fabric, and it also frays less because we're all making these masks so that they can be reworn and washed and reused. And the less the fabric frays, the easier it's going to be to wash and rewear.
All right, so then the next 2 parts. So this is what we did. We usually did 2 layers. We debated about filter or no filter, nose bridge or nose bridge, batik, cotton, flannel, all of that. So the second half of this we're going to do with our science panel, which was, can you just flip through really quickly? We saw 2 studies that were really, the American Chemical Study, which did a ton of stuff, and we're going to go through this much more carefully. They did some testing, and they had some ideas of what was the best thing. We're going to go through this more carefully with our science people. And then also the World Health Organization, which came out with a different study and a different set of recommendations. And so we're going to we have 5 scientists with us today to talk with us about all of these things, and that's what we're going to do after we do the next panel. All right, so we're going to take a very short break, like 2-minute break, because we have to switch out panelists, and we're going to make sure everybody's here. And I'm not as good at this technology. Okay, so we need to...
And just also to be clear, we will be sharing the slides with everyone once this is all over.
Oh, and this panel is sponsored by Grace Company and the Quilting Army Crew, who is we're an authorized dealer of Grace long arm systems. They have been super great friends to the Just Wanna Quilt project and has donated Fred, the finesse thread, which is so insanely great, as part of our giveaway. And some true cut systems and some rulers. And if you're in the market for a long arm, obviously come chat with us because we are insanely awesome about that. But also, proceeds of our sales of the long arms always go to supporting the Just Wanna Quilt project and our students and our graduate students, our graduate law students. All right, let's see if we can make the people that we need to make. Okay.
Yeah, and while we're on break, we're just going to pose a quick question to the chat. What organizations, if any, did you work with, or were you a lone wolf in the mask making? And how many masks did you make? I'm sure we already asked that several times. Who did you donate to? I saw some things about the Atlanta group in the chat. And did you make masks for friends and family? And tell us more about your mobilization experience, because that's what we just talked about with how things got started. And now we're going to go a little more in depth with our next panel about mass mobilization and groups and people that did organize.
All right, so those that I just made a co-host, can you turn on your cameras and your sound? There we go. And to make sure that I got everybody out of the... Did I get everybody? Lex is there. Allison. Oh, Allison, you're not... I withdraw your host. You're not in this panel. Chris, Gina, Sophie, Whitney, of course. Anyone else that I'm missing?
Hailey and Scott.
Scott, yeah. They're at the the bottom. There we go. Are we good? We got everybody. Awesome. All right.
So is Scott unmuted and video on or whatever? Just unmuted.
Great. Look at us. All right. We are so impressed with you. You are the story of entrepreneurialism in action. And we are going to tell this story because it is the best part of the story. And that's why we have you here. So thank you again. Whitney,
so this is our first big panel. It'll be about an hour. We're going to talk about mass mobilization, which is we mobilized, and we've interviewed each group that we have up or who they're representing. And you can hear that on the Just Wanna Quilt podcast, and it's available on all podcast forms. Today we will hear from those who helped us organize getting masks to those on the front lines that needed masks. Dr. Townsend-Guard's first interview for Just Wanna Quilt podcast was with Alexa Magyari. She is our co-moderator with Dr. Townsend-Guard. Alexa is a Ph.D. student at the University of California at Berkeley School of Public Health and a crafter herself with a blog, The Wannabe Grandma. She saw early that there was a need for organization, and she, like others who worked hard to make the homemade mask movement successful. Then we have Becky Blank. She's moderating our chat. She's a Tulane alum and our community partner for the summit and founder of We Have Masks. That's a group that sources, makes, and donates lots of masks. She also is manning, I already said that, she's manning the Q&A chat. We next have Cathy Dickey, and she organized the space.
Oops, somebody, yeah, we need to mute. Can you all now mute when you're not talking, or we'll get the feedback? And I don't see Cathy, so she must be working. But Cathy,
okay, we'll just move on to Sophie Barshani. I'm sorry if I butchered that, and Alex Woodbridge. Sophie and Alex are part of the TUSOM COVID Response Group, TUSOM COVID Response Group, a group of medical students, administrators, and faculty who worked to solicit PPE donations at the start of the COVID-19 pandemic in New Orleans due to the inability of PPE supply chains to meet demand. They are two of the 5 student leaders and 82 volunteers put into 2,142 combined hours in 5 weeks, obtaining over 250,000 units of PPE for local hospitals. Then we have Gina Livingston, and she's the co-founder of SMAH, Sewing Masks.
I don't see Gina either. Do we see Gina?
I swore I saw her in the chat, but maybe she's not here. I'll move on to Jana Zweeman.
So Hailey, can you double check and see if Gina needs a panel? Yeah. Okay, cool. Awesome. Continue. Sorry.
So we'll move on to Jana Zweeman, who's here. She's the co-founder of Pussy Hat Movement and Welcome Blankets, now Masks for Humanity. Jana Zweeman created Masks for Humanity, which is a hub that connects people who need masks to those who make them. Masks for Humanity shares the requests of healthcare and essential workers. And then we have Scott Bishop, Christine Schnitka, I'm sorry if I butchered that again, and Chippewa Thomas. Together, this trio from Auburn University helped coordinate an effort to leverage university talent to design instructions, recruit, and enlist the help of many volunteers in the community to sew over 10,000 masks for people across the state of Alabama. So we'll see what's happening with Cathy, Dickey, and Gina Livingston, but for now, we'll begin with you, Alexa.
Hi, everyone. Thanks so much for having me. So my story started around March 15th when I started seeing calls for masks on Twitter, and especially the Deaconess call for masks. And as a public health Ph.D. student and a crafter, on my Facebook page, I saw a bunch of people making masks and donating them to friends and family. But at that point, hospitals and other healthcare facilities weren't necessarily accepting handmade masks, and some hospitals were penalizing their employees who were wearing them. So I saw a need to create a database that included a list of hospitals that were accepting masks and the correct way to donate to those hospitals so that those hospitals could distribute masks so that they'd be used in clinically appropriate ways. And as a health economist, I have databases that include lists of all the hospitals in the US. So that seemed like a really great place to start. So what we did was I gathered a group of other PhD students, which eventually grew into a much larger effort. And we began systematically calling all the hospitals in the US and looking at other official hospital requests for masks and assembling that big Google Doc that a lot of people use to make masks. And I think our biggest contribution at the beginning was just legitimizing that masks were needed, because at that point there were a lot of articles coming out that said hospitals weren't accepting masks, and that really wasn't the reality of the situation. So like just legitimizing the need that, yes, we've surveyed these hospitals, yes, they're taking these masks, was a really, that was our contribution, I think, and we didn't really do organizing on the delivery side. We were more just on the demand side. So we really admire everyone that did delivery efforts, and that's who we're going to be talking today. So let's start with Becky. Can you tell us a little bit about how you got set up organizationally and where you concentrated your attention?
Yes, thank you. Can everybody hear me? All right. I'm Becky, and I'm a co-founder of We Have Masks, and we also have our group of sewists we call Mask Makers Collective. We got started March 22nd when we were made aware that there was a huge need for masks, and we saw the need for organization. We knew people were sewing, we knew people needed masks, and people were asking, where can they send their masks? How do I get masks? So myself and the co-founders of We Have Masks, we got together and created a nonprofit. I think within 3 days we were up and running, and we connect a need for masks. We have a request form so people can request masks facilities, and we have wonderful volunteers that have nursing backgrounds or know how to speak medical, calling and confirming and vetting the requests. And then we were connecting with those sewing masks to get masks to facilities that were accepting cloth masks. We also right away started taking donations and purchased N95s, professional grade surgical masks from overseas. And because we were purchasing thousands versus millions, we were able to get them in quicker than the umpteen millions the government was trying to rush in to supply the facilities. So we, two fronts, purchasing masks. We also did purchase cloth masks as well, because anything we could get our hands on to help. So purchase masks, and then also the homemade masks really helped fill that gap. I mean, that was our goal, was to fill the gap. There's a need. There's a supply chain hurdle. How do we fill the gap?
Yeah, so just real quick, sorry to cut the conversation off. I just saw that Gina joined and I wanted to introduce her really quickly. We have Gina Livingston was supposed to be a part of this panel and she just joined.
Hi.
She is the co-founder of Sewing Masks for Area Hospitals, which is SMAH. She, her organization made and donated many, many masks to like area hospitals in Atlanta.
And I have to say, their Facebook group, I was mesmerized. I was like this fangirl to watching you all work. And so I'm excited that everybody's here, but it was like, it became an obsession with me to watch your group working. So I have to say that. All right.
And we just got Cathy Dickey. She's on now, and she organized the face mask shortage for New Orleans local area, which was a sewing initiative. So the panel is complete now.
Awesome. All right. And so each of you, so what we see with these stories, with Becky's story, with Lex's story, is this is all of our stories, right? That we saw a need, that we had, you guys all organized. You had to figure out who needed the masks and who was making the masks. And so I want to quickly, maybe in 1 or 2 minutes, each tell your story. And then we're going to try to understand, because this is happening, we're just a small group. We're seeing in the chat, all these other groups. We're going to try to understand what made these groups successful. How did you organize? How did you do this? So that we understand, for the record, this collective movement that was also individuals organizing in this way. So we finished, we were with Becky. Let's go quickly and tell us when you do that, how many, if you have the metrics, how many volunteers you had, how many masks you made as part of that. All right, so who's up next, Lex?
So next we can go to Cathy.
Hey everybody. Cathy Dickey, New Orleans, Louisiana. I had one of my girlfriends worked in one of the cardiac ICUs, and after receiving a lot of patterns from very well-meaning people who knew that I was a quilter and that I loved to sew and wanted to volunteer me that I needed to be making masks for everyone, which I don't dislike the idea, but again, the same questions everybody had with what's the best pattern, what's the best type, etc. I just asked my one friend if she needed them, and we started a group specifically for her and a couple other of our medical professional friends, and it snowballed. At the moment, we've got about 650 group members. The face mask shortage in the New Orleans area.
Right.
We had 14 pickup locations throughout the city, 650 members. Generally, about 150 of those are makers, and we coordinated weekly pickups from the various drop-off points and then worked out distribution. And as of yesterday, we've made and donated about 15,600 from throughout
amazing,
throughout the city.
These numbers are amazing, seriously. All right, who's next?
So the next person is Sophie and Alex.
So my name is Alex, and with me is Sophie. And then usually our role at Tulane Medical School is running the student-run clinics. And when COVID started gaining traction, we offered to donate our personal PPE that we have for our clinical settings. to the hospitals. And just kind of by happenstance and talking to our dean and being connected with one of the infectious disease doctors, they asked if we could help with a PPE drive. And so over that first weekend, we ended up mobilizing over 100 volunteers. But we had that first conversation on Friday, and by Monday, we started collecting PPE and started distributing on Tuesday. We had volunteers manning our hotline phone numbers, calling local businesses and industry, asking for their stores of PPE. A lot of places have respirators that they use, like painting companies and like other construction companies. And so that was kind of our focus with reaching out to businesses. We also had volunteers that were manning when we were accepting like walk-in donations and distributing to the local hospitals. And so that's kind of the background on our project. So if you want to add.
What were your numbers? What were your final numbers?
Yeah, so hi everyone, I'm Sophie. I'm another fourth year med student along with Alex. So our final numbers, we had volunteers put in a little over 2,000 hours in 5 weeks. And as far as masks, we got 29,217 N95s, 181,467 surgical masks. We also had a variety of other PPE, like face shields, gowns, things like that. And our total number was a little over 250,000 units of PPE.
Seriously, right? Does this like give you goosebumps? It does me. I just like totally amazing. All right. Who's next?
Next we'll hear from Gina.
Jana, right?
Hi.
Yeah. Jana.
Yeah, hi. So I'm Gina Livingston with Sewing Masks for Area Hospitals in Atlanta.
Gina, right.
Yeah.
Perfect. Yeah.
So we're just doing how we got started and
how many volunteers and what your numbers were.
Yeah. So we got started pretty early on in the pandemic. A physician friend of mine at Grady Hospital, which is our county hospital in Atlanta, called up and said, we're looking at this pandemic coming, and do you think you could sew a couple masks so we can just see what this looks like? And so a couple friends and I sewed about a dozen for her, and she was like, these are great. We probably will need more. So I started a Facebook page and then quite quickly found the two other co-founders of SMAH, Kayla Hittig and Kirsten Hawkins, who had independently started other Facebook pages around this. Everybody is a sewist. These are just kind of the things we can do. And so I reached out to them, and we ended up joining forces, which is how we got our larger Facebook page group. So now we have about 8,500 members of our Facebook page. As of today, we've donated 59,303 masks.
Amazing, right? Seriously.
Yeah, it's incredible, to 152 facilities. I wasn't able to get the numbers from other chapters, but we had people reach out and say, we want to do this in a different part of Georgia. I think we even have a chapter in Mississippi. So I don't have those numbers, but that will add a couple 10,000 to
amazing
a larger total.
And how many volunteers do you think you had? Did you say that already?
There are 8,500 people on the Facebook page. In terms of active sewists, we didn't really keep track of that. You didn't have to put your number in with your donation, so I'm not quite sure. But it's at least 1,000, I would think.
Cool, awesome, cool.
All right, now is Jana.
Sorry.
Hey everyone, I'm Jana Zwyman, and I'm the founder of Masks for Humanity. And I started it really reluctantly. So I'm the co-founder of Pussy Hat Project. I'm the founder of Welcome Blanket. And in general, I'm really wary of I was just very wary about cloth masks entering into the space of medical grade PPE. And I think we're all probably on the same page as that. And just strangely enough, like how strange is it that March feels like eons ago, like back in the day in March, it was like this. So we went from a high, so I'm sort of going backwards. We wanted to make sure that organizations of essential workers, healthcare workers, but also the grocers, the delivery people, the people working at mortuaries, the vets, like all the people who are making everything still work would have access to cloth PPE because the hope was that medical grade PPE was going to come in like in a week or two. And then how would we think about the next step? So we hit a high of 437,000 masks requested. And now we're down to 328, or sort of, we went from the fours down to like the lower threes. So that's a combination of people who just joined our network as like individuals. And then also we love other groups. So this is for the panel. This is for all the people who are here. I think we all are in this together. So, we have requests from across the country. So if someone's in Missouri, I know we have 100,000 in Missouri that are being requested. And so I love this idea of collaboration and the fact that, I'm listening to Gina and the idea that there are all these people in Atlanta who are like ready to go, or thinking about how we have all these local groups, and Mass for Humanity sort of looked at it as this overarching of, if you don't know where your group is, we want to help you find your group. If you don't have a group and you're not into groups, that's cool. We want you to. Like, how can we get as many people able to help and have a way in? And if you have a grandma like across the country and she wants to help too, you can be like, go to Mass for Humanity. There's a list of all these ones. There's probably one near you. So it's still ongoing. So it seems like it's very exciting, but it seems like we should be at a point where we don't need cloth masks anymore. And to me, this is both like a really hopeful, this is a very hopeful, wonderful summit, and I'm so thankful to be here. And then it's also so frustrating that this is what we're doing. We're still here. Like, why are we still here? So thanks for having me.
Very cool. All right, and our last group, right?
Yep, the folks at Auburn.
You guys ready? Which one? Who wants to begin? Yeah.
I think I've been volunteered.
Awesome. Scott, go for it.
Okay, so we are 3 employees of Auburn University, and I work for the OSHA Lifelong Learning Institute as the director, which is under the Division of Outreach. And then my colleague, Chippewa Thomas, is also in outreach, and she is the director for faculty engagement. And then our other member is Christine Schnitka, who is on the education faculty. And so one of I think what makes our story maybe stand apart a bit is that the need was seen from above, and we saw the need, but the university upper administration saw it also. And in a meeting in the president's cabinet that we were not a part of, but Chippewa and I report to a vice president. There was discussion about this movement to make cloth masks and whether or not they were useful. And the director of the medical facility on campus spoke to that and said, yes, they are helpful, and yes, we need to be making them available. So long story short is that we were able to leverage the resources of the university very quickly. We had the Office of Communications and Marketing. We had the School of Industrial Design. We had a media production video group. Development gave us $20,000. And within a couple of weeks, we had a website, a pattern, an instructional video, and we had the industrial design school cutting patterns of making kits so that people could come by the headquarters of the OSHA Lifelong Learning Institute, pick up packs of pre-cut kits with the instructions for sewing them, sew them at home and bring them back. And another unit of outreach was responsible for taking orders and getting them delivered. So there were two groups. There was already this grassroots movement, right? Everybody knew about it. We knew about it. And so what we were able to do is sort of make their job easier. And at the same time, there was another group, which is the ones who found out about us through the website and the multiple articles that they put out about it. And you could just go online and click and say, I want to sew. And somebody would be back in touch with you about how to pick up kits, how to make this happen. And we had a huge response in our area, but we were also shipping out kits to Alabama and even beyond our state border. And then we were also sending made masks all over the place. Sometimes we were sending the kits and people were just saying, and I'm going to, for instance, sew these and give them to the cancer center in my town. So we made, I think at this point we've distributed about 11,000 masks, including ones that have been distributed by the sewists themselves. So they just sort of let us know when they distribute them. Another interesting outcome, the OSHA Lifelong Learning Institute is it's a lifelong learning organization for people, and most of our members are over 60 years old. And Chippewa and Chris have started a research project about the response of older people to this project. And so I'm going to hand it over, unless there's a question, I'm going to hand it over to Chris and let her talk about that.
So Chippewa and I are conducting a research study looking at the impact that this has had on primarily retired people over the age of 60. And the impact is, on their mood, their sense of purpose in the world, how they use their time, and how it's helped them cope with all the stresses that are part of this pandemic. We have interviewed over 100 people, and our interviews are between 45 minutes and an hour long.
It's a lot.
We transcribe them, and we'll be working for the rest of the summer on transcribing these interviews and looking at them through different qualitative lenses to look for meaning from what these participants are saying. We've interviewed people, a range of people all over the United States in about 35 states or more, all different ages. And so our first study will be looking at the older population of sewists and the impact this has had on them. But we will be looking at moms at home and people with disabilities and young people and what emotional impact this has had on them.
I totally love it. It's really amazing.
Can I add one thing, Chris?
Yeah, sure.
And one of the things that was so interesting to me from working on it through OLLI, which is short for OSHA Lifelong Learning Institute, how many married couples work together. Mm-hmm. It was just, I don't know if y'all have recognized that too, but it's so cool.
Yep.
Yeah. Especially older people who are at home and in a bad mood. It's like, now I have this thing we can focus on together, you know?
Chippewa?
I think the one thing that I want to say and reiterate that I think we're all feeling on the panel, but particularly for our context, working for a university, is that we really had the fortunate benefit of the support of a lot of different people. So the notion that upper administration, faculty, individuals in the community who wanted to mobilize and be a part of this really were part of a community engaged movement. And doors just swung open for us. So when you have the commitment of a community that is made up of all kinds of people, partners and the like, we really didn't have to struggle very much to make this mobilization happen. And I think that speaks to what happens when people really band together to work together, and the unity that was created as a part of it. I'm really hoping will continue, but is also something that our university is really committed to. And I think that that's valuable as well.
I think this, I don't know about you all, and the chat is just, if you've been following, the chat is just stunning and amazing. I know Alex has a bunch of questions. I keep seeing when I hear your stories, I see two things. I see those using existing networks like Auburn and Gina, that you already had a space, and then you have new networks being created. And so I think that that's the sort of, I want to talk about each of those, maybe the new networks. Lex, I'm curious. I don't know if you're curious, but how did we get all these volunteers so fast? Like, how did this happen? And I'm curious what your thoughts are about that. And I'll turn it back over to Lex to be our moderator.
Yeah, no, definitely. I think that's a good segue into thinking about sort of best practices moving forward. You know, there's sort of debates about whether or not we're going to have to do this again. And so just starting with Becky, can you tell us a little bit about the lessons that you learned from this experience and what you're going to take moving forward?
Yes, thank you. I mean, one of the big things that from my standpoint that I think is important, and I think we did fairly well out, is pausing for a minute to get organized. The need for masks was so overwhelming, and we kept going back and forth of, we just need to do whatever we can do to get masks where they're needed. But then we're like, we need to pause and set our foundations and set this up to run like a business, and set up our systems so that we can help more.
Let me pause you just right there. Did you all have systems? Did you all have to put systems in place to get it all coordinated? Yeah? Just, can you all raise your hand? Yes, the yes or nod big. Yeah.
Who used Google Docs?
Google Docs. Did you all use Google? Like, what did you all use Google Docs? What were you using to keep organized? No. Can you just quickly say what you guys all did to keep organized? I'm really curious. I'm not
Google
very. Yeah.
Is the jam in the share drive with Google was money. Because that's how we've tracked our makers.
Got it.
People that requested everything else.
Very cool. Others, how did you keep organized?
Yeah, we actually had a business consultant come in, a volunteer that we found on our page who set up an org chart.
Seriously?
And
I'm jealous. I'm so jealous.
And so she put us all in pods, and the way that everything has worked is that each pod is just responsible for the daily operations of that group. And then we have a weekly team meeting for everybody to report in. And then the three founders still kind of stay at the top, making sure everybody's pod is working.
And what was it, a software program that you were using? Are the pods something specific?
No, we just called them pods. They're, okay. We use Slack, to keep everybody in communication. And then, the shared Google Drives are of course important and great. But I think the org chart, like clearly defining who was doing what and who had responsibility for each part of the process was really central to the success.
Seriously. Alex and Sophie, how'd you keep all your people organized?
Lots of Excel.
Yeah. And if anyone knows me and Sophie, we love a good protocol. So we wrote out a lot of our protocol like early on, and just we did a lot of like weekly check-ins with our volunteers to try to keep an open communication line.
Interesting. Auburn, how did you keep organized? You had your alumni. You had existing networks and so did you? I'm curious, and Jana, I'm curious about that as well. How did you keep organized, and how did you communicate to your existing networks?
We sent out on our website and also email, and that was how we communicated with volunteers and new volunteers and existing volunteers. There was a moment when somebody just had to be answering email all day long, because we would be getting emails from people saying, I want to sew, can I get a mask, and we tried to be as personal and individual as we could be with each of those. And then a lot of Excel sheets.
Interesting. Yeah. Jana, what about you? Did you use your existing networks from your previous projects, or was it a whole new network?
Yeah, well, definitely reached out to our existing networks through the Pussy Hat Network, which tends to be more on the knitting side versus the sewing side. And then the way that we thought about it is we were a really tiny team with a lot of other commitments that were happening at the same time. And so we set it up as a system so that we could try to avoid to do as much email back and forth. So just being very clear about here's how you get involved, here's how you register, here's what you do. And so it gives the opportunity to be able to kind of spread more widely. But mostly Google Docs, a little bit of Slack, email, social media, website, kind of all the general kitchen stuff to be using. And it worked pretty well.
Yeah, it worked well. Yeah, Cathy, how'd you get everybody in New Orleans organized? Did they just come to you? Did they find you on social media? Like what? How did you get your volunteers?
It was all Facebook and word of mouth, and then some of the gals do the dance crews. The Marie Antoinette's crew had started their own event, and they were like, hey, you already have drop-off points and pickup spots and logistics built. Can we just join you? So we ended up absorbing that group, and I feel like there were a couple other like very loosely organized bunches that were like, you have infrastructure. Cool. And our big focus, we had folks from all over the country asking for masks. So rather than us sending anything to other people, I would work with other quilters from the Modern Quilt Guild and connect with, hey, do I have anybody in the San Francisco Bay Area? And then I'd find their mask making group and send that individual looking for masks to them. Because New Orleans became a hotspot so quick, so early on, I kind of led the charge of saying, here's our priorities. Our priority for who we're giving masks to are medical, first responders, and law enforcement. Those were the primary. And then secondaries were food pantry, kitchen folks, soup kitchens, and homeless shelter staff and things of that nature. There was just a lot of requests, and knowing that we only had a small amount of people, and that the vast majority of the makers in our group were home sewists, most of which kept complaining that they didn't understand why their needles kept breaking. They hadn't asked when the last time they serviced their machine was. There was a lot of basic tenets of maintenance of your sewing machine.
Yeah, we learned.
Don't leave it in the closet for 15 years and then be shocked that it doesn't work.
Awesome. I'm going to send it back to Lex for our last 10 minutes.
Yeah, so can you guys talk a little bit more about the role of social media? I know social media was big in sort of getting the word out that masks were needed at healthcare facilities and other organizations. So starting with Becky, how did social media sort of help you in your mobilization effort?
Social media was huge for us. We aren't centrally located. I mean, I'm in Louisiana, but we're nationwide. We have sewists all over the country. So we relied on social media to get volunteers, to put our word out. We posted what we offer. We're shipping kits. We pay for shipping to get kits to you, to get completed masks to a collection point. We're paying to ship masks from a collection point or sewist to the end user. And just putting that out there, what we offer really helped get the volunteers that we needed. So without social media, I wouldn't have known about the crisis as early. And I don't think we have masks would be here.
Do you all feel that way? That without social media, you wouldn't have been able to do your work? Yeah.
There's no way.
Yeah. Gina?
Yeah.
Well, ours has been entirely on the Facebook page. We have a website now, and our group is pausing to give everybody a break, especially the admin team, just like some breathing room.
Yeah.
But everything has been done on the Facebook page. It's like the lifeblood of the organization. Is that?
Yeah, I agree. It's really interesting how integral Facebook has become. It's like a utility. It's not a choice to be on Facebook in this environment, which I think is really interesting.
And it shows kind of like the best of what social media can be, when I usually think social media is pretty lousy in my own life. I'm not a super fan of it.
Yeah.
But to have the ability to connect when we cannot physically connect is
well, and
huge.
we saw with Seth that Seth got a group of 40,000 people in his group, and his video, not necessarily people from his group, reached 30,000 people on how to make masks. I mean, just the level of ramp up that happened because we could so quickly come together is incredible. Auburn, did social media play an important part in your institutional strategy, or was it mostly email and one-on-one communication?
It was mostly email, one-on-one communication, and the website. But I guess I need to stress that the already organized group, the East Alabama mask makers, have a Facebook page, and the person who's the admin of that and the founder of it reached out to me really early on, and he shared his email list with us, and they became aware of us almost immediately. So
very cool.
Sort of got adopted into that group.
All right, Lex, I'm going to send it. I'm going to try not to interrupt and send it back to you. I get too excited.
No worries. And one comment I just want to make about my group's experience with social media is that was really interesting, was that hospitals that were more adept at using social media to ask for masks seem to be in way less need now. Like, for example, one of our volunteers just single-handedly called every VA hospital in the United States 2 weeks ago, which don't tend to have as, progressive social media teams, right? They have sort of built-in patient populations. They're not vying for patients like other hospitals. And they are still in extreme need, which was really interesting. So I think facilities themselves are using social media in different ways that have affected this movement, independent of the mask makers, which I thought was really interesting. So let's transition to a little bit to talking about moving forward. So
can I say something that I found kind of interesting about that, like to what you were speaking about?
Of course.
We had this really interesting experience early on where some of the larger hospital groups in Atlanta weren't necessarily sure that they wanted to ask for PPE or like any help with masks. And we think that part of it was they didn't want the public to think that they were unprepared or ill-equipped. And what we would notice is we'd start getting requests from like the physical therapists on the fourth floor of a certain hospital would be like, hey, do you mind? We need some. And I thought, like that would not have happened without social media, is that we got requests directly from people. And then once we talked to them, like we were able to get the administration on board, and then we could ramp up and give them, 7,000 masks to distribute. But I don't think without social media, you wouldn't have been able to target a nurse on a certain ward in a hospital who was on the ground being like, no, we actually need N95 covers. We need something. And so that was really amazing to me.
I heard that story a lot. I thought that was a very interesting, that it was this kind of duality that happened, that the need was there. I'm glad you brought that up. It's really interesting that was part of the story. Lex?
And it definitely seemed to be sort of like once one hospital in the area started doing it, other hospitals were accepting it. Like when we would call and do our surveys, we would say, well, these hospitals are accepting them. They're like, oh, they are? Oh, then maybe we can too. And it sort of was like social transmission of accepting masks and sort of how the patterns spread as well. So let's think about what everyone's doing now. Are you guys still making masks? Has the sort of politicization, I don't know, whatever the noun form of being politicized is, affected your work? Let's go to Cathy on that.
So due to burnout for a lot of our makers and for a lot of our pickup points and the administrative group of our administrative leadership for us, we've taken a break. We've stopped doing pickups. We will help facilitate obtaining fabric or supplies if people need. if they're still making, and we'll still advertise on the group if there's somebody making masks for the protesters in downtown, or working with the Innocence Project to make masks for the prison systems locally here. But for the most part, we're kind of dialing ourselves down, just more due to the fact that a lot of our makers did have full-time jobs that are now getting back to going into the offices and things like that. So our makers are still making, and I'm still making, but we're not making at the same rate.
Yeah, we are too. That's the way we feel. Yeah. Is that true? Is that true of most of you, that I know the medical students, you guys are not doing it anymore. You're done, right? Are you done? Yeah.
Yeah, we're back
you're
school
done.
now.
You're back to school. Right?
Back up.
Yeah, you got to go back to school. What about others? Are you all in the same sort of, is there a slowness, or did sort of what's the curve look like right now?
Well, we've taken,
go ahead.
We've taken a break we don't know how long it's going to last. We saw the same weariness with our sewists. People would kind of post like, this is my last drop off. I need a break.
Yeah.
So it's kind of twofold. It's that they need a break, and then the admin team also needs a break. We also got 501c3 status.
Nice.
As an organization. So we're hoping that this can transition into just being a community organization that is able to swiftly meet the needs of things that are happening. So we're working on like establishing our board of directors and all of that. But
this is great.
Yeah, I will say for the future, our break, we still have locations to drop off masks open. So people who still want to sew can do that, and we'll fulfill requests as they come in.
Yeah.
As well as we can. The other thing, we have been donating masks to the protests, which did cause a little bit of friction in our group, to be honest. We made a public statement. Members of our admin team are women of color, and we support our Black members. And so we made a public statement about the protests that have been going on, and we did lose some members over it. So we're currently supporting protesters with masks. The other thing that we're looking to is that voter suppression is pretty rampant here in Georgia, as you may have heard from our primary election. And so we are currently working on a program to use our volunteer community to adopt polling locations.
Oh, that's great.
Around Georgia. And we'll be handing out masks and collaborating with other nonprofit organizations to make those voting lines as comfortable as we can for people, so that they're safe. There's food, there's water, there are porta potties, there are masks for everybody who's in line. So we are going to transition and really look at that.
Well, I would love to chat more with you about that. That's just, that could be a national thing. I think that's just spectacular. And clearly we have the power to do it. It's kind of remarkable. All right, so we are at 11:29. We have 3 science panels coming up. So I think we need to transition, take a break, go grab some lunch, 10 minutes, like 10 minutes. You do not want to miss the next 3 panels. They are like, this is what we're here for. I mean, we need the scientists to talk to us, and we have some questions for them as sewists, and I'm super, super psyched. So we're going to stop here at 11:30 with a 10-minute break. I have to say, this panel was sponsored by the Jaftex family of fabric companies, including Free Spirit, A.E. Nathan, Henry Glass Fabrics, Studio E Fabrics, The Blank Quilting Company, and Fabric Editions. You know them. They're the company that has Cathy and Tula Pink and Anna Marie Horner. We love them so much. They've been so supportive of the JustWannaQuilt project, and as part of the giveaway, we're giving away to some lucky winners some fat quarters of Kay Fawcett and other lovely fabrics that we have here, and some batiks. So we are so beyond excited about it, and we really do appreciate it. All right. Up next, the science and medicine panels. Go get a sandwich. We're starting right at 11:40, and we're super psyched. So I hope you're enjoying this. It's just thrilling to have. Thank you, panelists. Thank you so much for being here. Amazing. So amazing. Seriously amazing. I want to teach at Auburn, and I want to live in Georgia. That's my that's my dream. And I'm going to bring Becky with me. Yes. All right, guys. We'll see you in 10 minutes, and we're going to start to get the panelists ready for that.
I'm still monitoring the chat. There has been some questions about how to connect with some of the groups.
Cool.
there's still people that are sewing, want to know where to send. So I'll
Awesome.
make sure those of us on the mobilization group, we will get together and make a list, and everyone that's attending, we'll make sure that that's available to you. So if you are still sewing and need to know where to send it, where you're to send your mask, or if you want to get a kit, whatever it is, if you want to still stay involved, we do recommend taking a break. Take a break.
Totally.
Oil your machine.
Do something fun
clean all the
just a
dust
little
out of
bit,
the bobbin
right?
section.
Yeah.
But there is still a need. We don't want you to get burned out. There's a huge need still in different areas. So we will get you that information. Go grab some food.
So are you, while I'm getting our new panelists in, tell us what you're hearing in the chat. Give us a little report of what you've learned.
Well, I've been trying to watch and talk, and then also bouncing back and forth. To be honest, like, I just keep getting goosebumps. I mean, it's just so wonderful. The outpour of everything. Keep sharing your story. We're going to keep putting prompts. If you've joined us and you weren't right at the beginning, say who you are, where you're joining from, when you started making masks, how many you've made, or the group you're in has made, what type. Tell your story. Put it all in the chat. Please share it with everybody. I mean, it's been wonderful. We are trying to get to your questions. Anything that I can't answer right away, because I'm trying to monitor the chat and questions, I'm putting it in a file, and we will make sure some of these more detailed questions get answered. So don't worry. Anytime you put something in the question, the Q&A panel, we're capturing it. If we can't answer it right away, it will get answered.
And also your questions that you asked while Becky was a panelist just now, I wrote down for the file as well.
Perfect. And I've been copying and pasting them and into our file to make sure we get an answer to everybody. So don't worry. And please ask a question. Even if you think maybe it was already asked or already covered, ask it, because you're probably not the only one.
Awesome. Look at us. 7 minutes. So awesome. So definitely go get a sandwich, because we are full steam ahead when we come back. Any thoughts? Anything going on while I'm just amazed by the day. I don't know. I just, and Whitney and Lex and Hailey, we're keeping it all going, which is remarkable. Seriously. What are you thinking of? You guys there? I don't know if I've gotten everybody. So yeah. Lex, are you still there?
Sorry,
yeah,
eating.
That's okay. I'm going to take a sip of soda. What are you thinking about the day so far, Lex?
I think it's awesome. I'm loving the chat. Sorry.
The chat's amazing. Seriously. The chat is rocking it.
And I see some people are asking questions in the chat. If you look at your Zoom screen at the bottom, it'll either be off to the far right, or you click on the 3 dots where it says more and it says Q&A. Please ask your questions in there. That way they're separate and we can make sure we don't miss them. I'm seeing some in the chat about patterns and other questions. Go ahead and go to the Q&A and type it back in over there. And that way we'll have them all captured and we'll be able to get back with you with an answer.
Awesome.
I think we definitely should make sure that Jocelyn addresses kids' masks, because she does a really good job with that.
Okay, cool.
And that's been a big question that I've seen
yes.
times. And also cleaning masks.
Yes. I was just about to say that. So that's been a little bit of the repetitive question, which is great to know, because that shows us we still have questions. We've gone through, we're still learning, are cloth masks okay? 1 layer, 2 layer, 3 layer, what style, what fit? And so now kids, they're going to be going back to school. What's recommended? What's the best fit, the best type? How do we wash masks? So that we're not degrading the life of the mask. And really it may not be, I seriously doubt it'll be a one-size-fits-all answer for the kids' mask or washing, because it's based on material. With children, obviously, as we found with adults, size and shape of the face and such. But these questions need to be asked, because if you don't ask, we won't know. I mean, that's how this all got started. Wait, are cloth masks okay? Let's do a study. Let's find out. So in our next panels, that's what we're going to be digging into. So it's going to be very exciting. If you're taking a break, leave your Zoom open. Go grab some food, take a quick break, because you're not going to want to get up from your computer or tablet or phone once these next panels start.
Awesome. Whitney, are you around? What are you thinking about the day? Are you there? Yeah, tell us what your thoughts are as we're on this break.
Yeah, it's really amazing to hear everyone come together with the conversation of things, because you and I have interviewed, and Hailey have interviewed people, and Alexa and Jack, who can't be here today,
Yes.
but I've all interviewed people individually for the JustWannaQuilt podcast. And it's really great to see everyone that we've interviewed come together and have conversations about all of the things that they're doing.
Seriously. And it feels like it really is creating this quilt, this patchwork of voices that are, you sort of see sort of what it was and what it is in this really amazing way.
And I really love reading in the chat all of the comments that people are talking about. The summit is just helping them get through their day, and it's making them happy, because I think that all of us I feel like at the core of everything, everyone got involved in making masks, researching masks, all realms of masks, just because we all care and we all wanted to help. And it was kind of a way of coping with all of the confusion going on at the start and even now through the pandemic. Or at least I know that's why I started.
Yeah, absolutely. Interesting. All right, I'm not very patient. We've got 2 minutes, and we're still waiting for one of our panelists to arrive. I think he was here, and then somehow he's not, which is okay. Awesome. Okay, well, why don't we transition to getting our panelists ready? I think I've made you all co-hosts, Dr. Rando, Dr. Wilson.
Yes, and Dr. Chad Roy just emailed in and said he might be 5 to 10 minutes late.
That is totally cool. And then who else? There's one more. Dr. Bishop, I know you're on a next panel, but I thought we might just bring you in. So in case there's anything that comes up, but you can be welcome to be on this panel if you'd like. And you don't have to if you don't want to. We're doing a one-on-one session with you after this panel. So this is our science panel. Hey, yay. Thank you so much for being here. I'm so beyond excited. Seriously, I was in a faculty meeting, Dr. Wilson, when they were talking about and hi, Dr. Rando, that when they were talking about what they were doing to get the school up and ready. And I was like, I've talked to 2 industrial hygienists and I know what you're talking about. So I felt like I can't wait to have this panel and talk about masks and the science of masks and the science of the virus itself is what we're really focusing on this panel. We've got 1 minute till people are back, and we'll sort of go from there. I'm not very patient. I always try to start class early. It's annoying to people.
Yeah, and Jack, Dr. Mark Wilson and Dr. Roy Rando. Jack was on your interviews for the podcast, but he's unable to make it today for this conversation.
Yes,
unfortunately.
He sends his best wishes. He's not feeling well. So, okay, so it's not. Okay, so we have a lot of questions. Let me see. I have a script. I have questions. Hold on. Okay. You ready? Go for it, Whitney. Start us off.
All right, so this is our first science panel. We're introducing Dr. Roy Rando, who is the Vice Chair and Academic Director for the Industrial Hygiene at the Tulane School of Public Health and Tropical Medicine, and an Associate Professor in Environmental Medicine at the Tulane School of Medicine. His research focuses on occupational respiratory disease and occupational and environmental inhalation exposure and assessment, or exposure assessment. Dr. Mark Wilson is a molecular toxicologist and industrial hygienist, as well as an associate professor in environmental health at the Tulane School of Public Health and Tropical Medicine. His research focuses on the role that modifiable lifestyle factors like obesity plays in increased sensitivity to the negative effects of occupational, environmental, chemical exposure. Dr. Chad Roy, who will be joining us shortly, he's in a meeting that's running over, is the Director of Infectious Disease Aerobiology at the Tulane National Primate Research Center and faculty in the Department of Microbiology and Immunology at Tulane University School of Medicine. His career focuses on respiratory health and the aerobiology of airborne infectious disease, including biological threat agents such as anthrax and ricin, to name a few. He is currently leading a research team to advance vaccine development for COVID-19.
All right, so thank you for coming. So we're so psyched to see you. I thought what we would do with this panel is go back to the science and understand a little bit about the virus itself. What you all know and what we should be knowing just in general in the public, and then a little bit more about the masks, just sort of understanding the virus in relationship to why we're wearing masks. So maybe start with sort of what do we know at this moment about the spread of the virus?
I think Chad would be the one, Dr. Roy would be the one.
Yes, I know. Indeed.
The best handle on that.
This is a bit of a problem. Okay, well, let's, where do you want to start? We can start anywhere you all want to start. Do you want to start with, let's start with this. What is an industrial hygienist? Or hygiene. What is industrial hygiene and why are you here? Like, what does that mean? We all care about you two very much in our world right now. And why is that?
Do you want me to do that, Roy? Or?
Go for it, Mark.
All right. So industrial hygiene is the anticipation, the recognition, evaluation, and control of hazards in the workplace. And effectively, that deals with any type of agent in the environment that can impact your health in a negative way. So that includes everything from physical agents like heat stress, ergonomics, all the way to chemical agents and biological agents. So it covers a very, very broad scope associated with things in the environment that can harm you and how to be around them safely.
Awesome. And so how does that interact with what's happening now? Sort of in what way do we need an industrial hygienist or industrial hygiene with this virus?
So effectively, when you work in a lot of industrial situations, you work in a hazardous environment. You're working with dangerous things just by definition of what you're doing. So our field focuses on how to be around those dangerous things, but to not be exposed to them. So we apply various exposure mitigation strategies, everything from engineering controls like ventilation systems and shields in front of people, to personnel management strategies to limit the amount of time that people are exposed to things, and personal protective equipment as well. And like, effectively, that's what we're here today is using PPE as a exposure mitigation strategy. So that's kind of where we fit.
So we hear the word PPE a lot. Can you explain what that is? And we have some slides to work with if we need to, but help us understand what PPE is.
So PPE is personal protective equipment. And it's actually the last thing that we like to rely on from an exposure control point of view in industrial hygiene. Effectively, PPE is a barrier in between a person and a hazard in the environment. And if that barrier fails or if it's used incorrectly, then exposure occurs. So what we like to typically do is to engineer the problem away so that you don't have to rely on a barrier.
And so
some situations you just can't do that for.
Okay. So while we wait for Dr. Roy to help us understand the virus itself, what are you seeing and sort of what's happening? Like, we all are in our, well, a lot of us were in our homes, and now we have to go back out to work. Sort of how are you being employed, or what kind of things are happening to keep people safe, and what are you seeing in terms of the virus and making a safe environment or safer environment?
Well, decreased occupancies. I've seen a lot of that.
Right, we see that, right? Yeah, and yes, go ahead, Dr. Rando.
Yeah, reducing occupancy, as Dr. Wilson just said. The other thing that we're seeing commonly implemented is physical distancing.
Right.
Of course.
Yeah.
And then sanitation practices. Maybe a little bit on trying to utilize better ventilation in enclosed spaces indoors.
Yeah.
And then, of course, the use of personal protective equipment.
Right.
Yeah, so as you guys are industrial hygienists, and we talk about the big thing now is things opening back up, people going back to school, college campuses opening back up, people going back to work. What are some of the main concerns when it comes to people re-entering like public spaces in the private?
There are a lot of concerns in trying to implement all these components of the infection control process. I'll give you a good example. How do you handle elevators? You know, our particular school building, the Tidewater building, has a bank of elevators. It's a 24-floor building. You know, during a normal academic year, when we have several hundred students present, those elevators would typically be completely at capacity, especially on the hour, you know, when classes are changing and so forth. Students have to move around different classrooms. So under the current scenario, if we're trying to maintain physical distancing, how many people can we safely get into an elevator? And then how do you limit?
Do we know how many people could be safely in an elevator?
The School of Public Health is going with 2 persons per elevator max.
Wow. That's craziness. That's going to take forever. How are you guys going to, like, that's, I mean, you think about the buildings, like all the high rises around our country. That's, you know.
One of the things the school is doing is that the main level for classrooms is on the 12th floor of the building. That's changed now going forward. They're moving all the classrooms to the first floor. So they're converting some space on the first floor into classroom space to try to increase the capacity. But the idea is to try to limit as much as possible the need for students to use elevators to go to the upper floors.
Yeah. Okay. So we're going to take this is going to be very personal. So we're going to get back to masks once Dr. Chad Roy is here. But right now, we all live in this world. So you're saying to us, don't get on an elevator if there's more than 2 people. Because that's like, we're going to be in all these places where they are implementing things and not implementing things. But that seems like a good way to think about it. You don't want to be on a crowded elevator. Is that right?
I think that's good advice.
Okay.
And, you know,
what if you're in an elevator and they're not wearing it opens, or people get in and they're not wearing masks? Do you think that you should get into that elevator or not?
I would probably hesitate to get into it.
Yeah.
So I have a question. When we talk about building ventilation and knowing that the virus is respiratory, how do those 2 things interact and come together in relationship to protecting yourself from the virus when you're inside buildings?
I'd say they're pretty well out of your control. I mean, you don't really have a way to adjust building ventilation systems at the individual level. So whatever the like in the office building I'm in right now, there's a thermostat on the wall behind me, but it doesn't do anything. So like the ventilation just kind of is what it is. But there is some really good information out there showing that if you pipe in a whole bunch of fresh air from the outside, that you can decrease the infectivity of coronavirus pretty significantly.
So how
there's an excellent National Academies presentation on that. I can share that.
That would be great. So if we're in a building or we're in an office and we want to know, like, if they are doing what they need to do, what kind of questions are we asking them about ventilation? Because I think that is a concern to a lot of people, that if it is traveling in the ventilation and if they can adjust the ventilation, what should they be adjusting it to so that we can be asking that question?
So that kind of gets into real specifics about air change rates in buildings. But effectively, what you really want to know is whether or not the air is being recirculated within the building, or if fresh air is coming in to displace air inside. A lot of buildings that are really energy efficient are real tightly sealed, so they recirculate their air. So, it's a double-edged sword between efficiency in buildings and striving for green buildings and stuff, and the potential for causing problems for bioaerosols.
Interesting. Wait, do you have a follow? I have a follow-up. Do you have a follow-up, Whitney? No. So when we have the flu, do we see increased worries of the flu going through the ventilation system? And is this different than COVID? Like, how do we understand what's happening right now?
I'm sorry, I missed that.
Yeah. How is this, like, the ventilation system? Are we always worried about the ventilation system making us sick, like the flu or common colds? Or how is COVID different than that?
So what?
Yeah.
Sorry, go ahead, Roy.
No, I think, again, the primary transmission mode is through inhalation for both influenza and coronavirus. The object here is to try to reduce the concentration of infectious particles, right? And that's what the ventilation is helping to accomplish, by simply diluting out those infectious particles that are being emitted into the air inside the building by infected people when they breathe and when they speak and when they cough or sneeze.
Yeah.
So the ventilation is helping to dilute those. And in industrial hygiene and toxicology, the dose makes the poison. And so generally, the lower your exposure dose, the lower your risk is going to be. Now, we don't know what the infectious dose for coronavirus is, but if you can reduce the exposure dose, you're certainly concomitantly reducing the risk for developing an infection.
Okay, so I see the summary so far is: don't get on an elevator that's crowded. Don't get on an elevator with people not wearing masks. Ask at wherever you are about the ventilation, whether it's recirculating or they're bringing fresh air in, and that we're not sure how much. And then I guess the next part, and Dr. Royce, thank you so much for coming. We're so excited that you're here. And then I guess the question is, what's the role of masks and protective gear? And if you are having to sit in meetings or in offices, how do you, and you're in the circulating air and people are social distancing, what is the role of protective gear? And I feel like I'm going to have to super suit up is all I'm saying. So what do you think we should be telling people as they have to go back to work in buildings that may have recirculating air or they're afraid of the air conditioning?
Well, the role of the masks is really twofold. We talk about the source of the exposure, the source of the infection, that's an infected person, right, who's shedding virus. And then we talk about the receptor. The receptors are the people around that person who are susceptible to inhaling the virus-containing particles that are being emitted by the infected person. And so the face mask can help control both of the receptor and the source to a certain extent, right? And so in this context of infection control, you're trying to minimize the amount of virus that's being shed into the atmosphere by the infected person. The masks help to do that. They're not 100% effective. We always have to get that. so the mask will help reduce the load of virus that is being breathed out or coughed out into the atmosphere from the infected person. And then the people around the infected person wearing masks gain some personal protection themselves by wearing the mask again. It's not close to being 100% effective, but face masks certainly reduce the potential exposure for the individuals surrounding that infected person.
Awesome. And then two more pieces, and then we'll turn to Dr. Roy. We've learned from you that it does get transmitted through your eyes. So wearing glasses, do you think? Like if you wear glasses rather than contacts, that's my first question is like how suited up, and also like how suited up should we be getting in these environments? How scared should we be, I guess? I don't know, especially in environments where we're teaching or there's lots of people. Yeah, my family's making fun of me for like what my plan is. So what are your thoughts about that? And then
So I'll comment on that.
Comment on that, and then thank you for being here. I'm so psyched you're here. That's so great.
So one thing that we have learned with this particular virus is that it is unusually hardy in the environment. We've just published data on that. On that specifically, and then some empiricism around that with respirable particles. So, how we've talked about the 6 feet and the social distancing. And this is unusual because we've shown that the virus maintains replication competence over long periods of time in very small particles. And so that can impact how we consider protecting ourselves. And some of the things that Dr. Rando was just mentioning in terms of personal protection and concentrations. So that being said, we all have to contextualize the environment that we're in and the risk, an associated risk with inhalation of at least a multiplicity of these viruses to induce an infectious process. So what does that mean? Well, it means that you have to use kind of the reasonable person attitude with this. And I spoke earlier with the Washington Post on how to assess a restaurant when I go into a restaurant as they start opening back up.
Yeah.
And is it, incumbent on you to assess the ventilation system of that restaurant? Well, absolutely not.
Right.
Nor would we have the tools or skills that we need to do such a thing. But if it's a stuffy restaurant and with, what you can tell, poor ventilation, with people crowded around their dinner tables, then that's something that we probably don't want to do at this time, just to further reduce risk.
Yeah.
We need to all keep in mind that this is not binary, meaning you're not going to catch, it's all on a gradient. It's not like you're going to catch it or you're not going to catch it. It's just a matter of risk and reducing or allowing your risk to be at a level that, that you could possibly contract this disease. And so the use of masks, for instance, that are not respirators, so these masks that are sewn, that's mostly for protection of others from you if you are asymptomatic and infected with this. It does not have, and as we had talked before, the way that they're comprised and composed of of what they're built with to protect you effectively against concentrations that may be in the air of this virus.
Yeah.
For things like the eye and infection through the eye, for instance, should we all be wearing goggles when we go out into public or that kind of thing? Absolutely not. That's not something that is would be considered a reasonable accommodation to further lower that risk in that gradient of risk that we're talking about. And so that, without getting too granular about, this, doing that, doing the other thing, we just all need to keep that in mind, that a reasonable accommodation can effectively lower that risk going forward, and that nobody needs to go out like a spaceman.
Totally. I so want to be a spaceman. Okay, so let's go backtrack a little bit. Can you help us understand, because we see it's a bunch of science, and we're going to talk a lot about science over the next hour or so. Explain the difference between the big particles and the little particles, and how the virus, tell us a little bit about the virus so we understand when we're reading these science things what it is.
So one of the big parts of that cause a lot of confusion in this is that when people visualize a sick individual coughing out, for instance, or in exhaled breath, they visualize these viruses in the air. And viruses, this virus in particular, the size of it is about 120 nanometers. Well, what does that mean? It's very, very small. I mean, particles are small, aerosols are small, but this is very, very small, just like other viruses. So they cannot exist in the environment by themselves. They need to be in an aerosol that is a kind of a carrier of this. Now, what does that mean when somebody's breathing it out? Well, when you cough or sneeze or even exhale breath, the particle sizes are heterodispersed. Some are very respirable and small, some are quite large. And the large in the context of falling out of the air column in about 2 meters. So those would be the size consistent with that. And that's why we're socially distancing. The reason that we want to do that is that if you can remember way back when to high school physics or otherwise, that these are cubic volumes in these particles. And so the particle that's that large contains thousands of times more biologic load than those highly respirable particles that can float for a longer time. So they have a bigger wallop in terms of the ability to cause infection. That's and really so those large droplets, that's why we want to avoid those as best we can. That's why we're going through all this pain and suffering of social distancing and this, et cetera, et cetera. And so what we call the quanta of infection, the probability of infection associated with exposure, is dramatically reduced if you can avoid those larger particles and that people breathe out or cough out or sneeze out. And so that's the kind of the scientific basis for social distancing, is to avoid those large particles that potentially have all of that virus in it, not just one virus, but many viral particles in one droplet that are not as easy to inhale as the smaller particles, but they can still get down there. And so that's an effective way to reduce our risk as it pertains to respiratory exposure. And I got to mention to the group too, it's kind of daunting explaining these things because my former professor is on this panel. And I always get embarrassed when I talk about aerosols because he taught me aerosols 25 years ago.
Right, I get it.
And so,
it's like
Dr. Randall, I'm doing my best.
It's so great. It's like when your parent is in the car when you're driving, you turn into this 15-year-old again, right?
Absolutely.
It's very weird. Okay, so you did a study that you talked about on our podcast that I would love for you to chat about, which was how long these teeny tiny particles last. That got me to I have more questions. So you tell us a little bit about the research you're doing and what you're finding.
You broke up there. I'm sorry.
Tell me about the research you're doing on the teeny tiny particles and what you're finding.
Sure.
And,
So what we did earlier this year is that we acquired virus that was from the index case in Seattle, and that virus was propagated, and we brought it into the laboratory, and we characterized it when in aerosol. So we synthetically generated aerosols in a very safe manner in a biocontainment laboratory. And then we studied the characteristics of those aerosols that were generated. And we shared in that task with 3 other major laboratories throughout the U.S., one at the National Institutes of Health, my former laboratory, which was at Fort Detrick, the USAMR, the U.S. Army laboratories, and then University of Pittsburgh. We all did the same types of characterization, and we compared those characteristics of this virus, the SARS-CoV-2, with SARS, the original, from 2003. And then we compared MERS, which is a Middle Eastern respiratory virus. These are all beta coronaviruses. Those 3 are the emergent beta coronaviruses in the last 25 years that have caused human infection. And what we found is that in terms of hardiness in aerosol, the SARS-CoV-2, our present virus that we're dealing with this pandemic, is much more hardy than those other 2, than the SARS and the MERS. And so then we took that a step further, and we wanted to understand how long this virus maintains replication confidence. So kind of like how long it lives when it's suspended in aerosols. So we have some very specialized things that we use to do that. And we measured it over a long period of time. And we made our particles that we were generating very small, just about 2 micron. So the respirable form, not the large droplets. And lo and behold, we got out to 16 hours of suspension time, and it still maintained replication competence, meaning that it was still infective at 16 hours in aerosol. And that's very unusual. Not many flu, you name it, viruses can maintain infective potential that long, over 16 hours. And so those are preliminary data.
So you all, when I talked to you, you said you guys were kind of freaking out by that. That was a surprise.
Yeah, it kind of freaked us out. Yeah, a little bit.
Okay.
It was a very notable result, and so we're repeating that, of course. But what we did is we packaged that up into a scientific publication and submitted it, knowing, with all the caveats that it's a very preliminary data, but everybody was, had such an urgency.
Right. So
anyway, long story short, that has been accepted for publication. It's going to be in Emerging Infectious Diseases, the journal that CDC runs, as a kind of a dispatch, an early dispatch.
Now you said the good part. Tell us the good part of the story, because that part of the story is freaky.
The good part of the story is that the colleagues at Homeland Security were doing studies that were very, very similar, and they just published that data that shows that if this virus in aerosol is exposed to sunlight, that the half-life goes from 16 hours all the way down to 1.5 minutes. So
it's amazing.
Sunlight has an incredible effect on this virus. Right. And that's just been published in the Journal of Infectious Diseases.
That's amazing. Okay, so I, of course, was talking to my husband. So now I'm like, okay, it's okay to go outside. No, but you can't go out in the dark. So my question was, like, if there isn't sunlight, or if you're indoors, is it going to linger for that longer period of time because it doesn't have the sunlight, the UV rays to break it up? So do you know that, or do you have a hypothesis of, like, don't walk at night? Is that the new thing, or like what?
No. So remember that this scientific data is not very translatable to real life. So what we did is we wanted to see an effect. We wanted to see a change. So we controlled everything around this experiment. That's what we normally do. And we got to observe that phenomena.
Right.
But to translate it to, hey, what do I not go out at nighttime, or, that kind of thing.
Right.
that's probably not a great idea. This data package, just like we had talked in the interview, is used with a compendium of data to make public health recommendations. And those are not made by the science guys and gals.
Right.
We're just feeding that process.
Right. I need you on speed dial. Remember we used to have speed dial, right? Number one, I'll put you in the number one slot. Okay, so the other thing that I thought was really interesting for our interview was how scientists are working together. And so I wanted you to tell our audience a little bit about the fact that there's so much collaboration happening right now. And it was very heartening to hear this. And then I talked to John Christie after our interview about how Tech Transfer is handling all this collaboration, which I thought was really interesting. Yeah. So, Dr. Roy, we're almost done with you. I don't know if you need to go early before the panel ends, but Dr. Roy, can you tell us about how scientists are working together to come up with whatever happens next? It's an unusual time.
My personal experience is that the WHO reached out early, and I went on a working group, and I think this is what you're referring to. That every week, now it's twice a week, we are thrown together with nearly 200 other folks that are working on developing an animal model for COVID. Our focus here at the Primate Center is non-human primates, but there's people working with rodents and that sort of thing, as well as characterization of the virus and actually vaccine development, and how we're supporting vaccine development, but it's being done literally internationally. So it's really not done a lot, but this has been a really interesting process because everybody, as soon as they have data, throw it into this working group without regard for things like IP, which is pretty amazing because there's a lot of big pharma that's involved in this as well, and they are more than willing to throw this in, as well as academics, and then of course different governments involved. And this includes like the Wuhan Institute that's playing a big role in this, Institute of Virology, with their animal models, with their characterization of the virus. They were kind of at ground zero there. Folks in France and Germany, a lot of folks in the US, but it really is an international effort. It's all being coordinated by WHO. I'm so fortunate to be a part of it, and it is so interesting to see that happen and this open exchange of data in real time. It's been very informative for our work here, and so it's really neat to see that happen.
Whitney, do we have questions from the audience?
Yeah, so I've been trying to moderate the chat and the Q&A. So if you have more questions, please put them in the Q&A. So a couple that I wrote down were that someone asked, they're curious about dorm living in the fall, and are masks necessary, and when are they, if they are? I guess in terms of when you're living amongst other people in dorms.
If it's the policy of the university, they're probably necessary.
Okay.
Yeah.
So
from just a functional point of view. But again, I think it comes back to what Dr. Roy was talking about of just, doing things that make sense.
Awesome.
So, yeah. I mean, you can live in a dorm and still be reasonably isolated. You can also choose to do things.
If you're a hermit, you just study and you're saying they're okay. If you're not social, is that what you're saying? I'm just teasing. But you can live in a dorm and be like, I have no friends. Yeah.
I would think there would be a large difference in being social, doing something like playing intramural sports outside versus being in a choir.
Yeah, totally. Right, totally.
So it's just those kind of choices that individuals can make.
I would have been okay
but it's a consideration that I would be weighing.
Really?
Yes.
Do you think, because there's some dorms around the country that are not requiring masks. We're seeing that on social media. As a parent or as a person going into the dorm, would you be worried about that?
I have to depart.
You have
I'm
to
so
go.
sorry.
I figured that.
So,
Dr. Roy, thank you so much for your time. I know you're all busy, and I really do appreciate it.
Yeah, I got to join something else.
All right, bye. Yeah, thank you.
Bye-bye.
Bye. Okay, so we're back to like the practical. So I have a bunch of practical questions. So if you're in, go ahead.
Can I just pose a few more questions
that have been asked in the
Q&A?
Yeah, of course.
So someone else, I have a few more questions from the Q&A. Someone else said that they're asthmatic and they're very afraid of catching the virus. And they say they wear a mask every time they leave their house, which is rare. And they want to know if they should wear a mask when they're just walking outside, even if it's just them alone or with their friend. Do you all have any answers to that?
I would say they wouldn't necessarily have to wear a mask if they're out alone, outdoors. There's no source of infection, right? So the risks would be minimal under that sort of a scenario. So if you go out for a walk in a relatively deserted park or something like that, not a lot of people around, certainly no one within 6 foot physical distancing limit, or even close, then there's probably no need to wear a mask. Remember the primary purpose of these masks is not to protect you, it's to protect other people around you in case you're infected and you don't know it. We always have to keep that in mind. Anyway.
So someone else asked a question. They said, has any destructive temperature testing been done on COVID-19, if you're aware? And they also want to know about UV as a degrading means. And they're asking if it's similar to SARS.
I can't speak to the similarity to SARS. SARS is a coronavirus, but UV will cross-link it and it will render it inviable, but it also is pretty bad for you. So like if you were going to use UV as a sterilization agent, you don't want to sterilize yourself because it's really bad for your skin, really jacks up your skin cancer risk. And there's the only temperature studies that I'm aware of associated with the virus are autoclave temperatures, which are 120 degrees centigrade, which would not help us in general for environmental decontamination.
Okay, and lastly, I think this plays into what you all do with industrial hygiene and just buildings opening back up to the public. Someone wants to know how faith-based organizations should handle COVID-19 situation, the pandemic, to hold services.
I think the key is to try to maintain the general guidelines that we've seen put out for the general public. Physical distancing, wearing face masks, and so forth. That can still be done in houses of worship. I've seen churches that are, for example, roping off every other row of pews, right, to force people to physical distance, and just follow the guidelines thing for the general public.
Yes, and I think that also plays into the fact that you can't wear a mask and feel a false sense of security. It's a culmination of things such as social distancing, mask wearing, washing your hands. It's not just one. So I think that I'll pass it back. Oh, I just got one more question. Oh, well, that question will be answered in the next science panel. So I'll pass it back over to TG.
Awesome. All right. So I am the bearer of ridiculous worries. So I have had some questions about what about like all the fears. So I go to work I'm a little scared. So touching doorknobs, touching other things, and have to use a restroom. Sort of, how do we stay safe in public spaces that you have to touch and interact with things that may make you nervous?
Be cognizant of your own hygiene practices, diligent about hand washing, diligent about using hand sanitizer when you've touched common surfaces. But, you know, as Dr. Roy mentioned, it's not a binary thing. We're all operating on a gradient of risk. And that gradient that I'm willing to accept may be different than yours.
Yeah.
So there really isn't a right or wrong answer to what we're supposed to be doing. But we all have to take responsibility for our own behaviors that we can control. And, you know, try to stay away from people who are doing egregiously crazy things.
Yeah.
But that, too, is not always in our control.
Right. So that's another problem. And the university and all of these places are trying to have anonymous systems to let people know, so there's not like a tattletale system happening or something like that. What about the elementary school? What about the snotty kids thing, right? Preschool, elementary school, are they carriers? It's a hotbed of yuckiness, right? And so sort of how do we, and wearing masks and social distancing when as a kindergartner, how are we, as a society, sort of, should we approach this part of it?
So I have a 7-year-old.
Oh, you're an expert. All right.
Yeah, and I'm the world's worst first grade teacher. And I really want schools to open again. And I'm not alone in that boat among my friends that have children of similar ages.
Yeah. Are you worried, though? Are you worried about them getting sick or being carriers? Or how are you going to protect your kid and your family in that environment?
I'm more worried about my kid getting sick and bringing it home to me or my wife.
You are.
Because children seem to weather it a little better than older people.
Mm-hmm.
But you know, I'm also reticent to put his life on hold.
Yeah.
Because of fear.
Yeah.
So I just have one more question from the chat, or more questions from the Q&A are coming in. And someone asked, if someone is a mask wearer and is a loud talker and tends to produce a lot of droplets, how far traveling and how long lasting would the virus be in those people if they had the virus? And would crossing the street to avoid them and the group they're in be appropriate?
Well, yeah, there's clear data that shows the louder the amplitude of your voice when you're speaking, the more respiratory droplets you produce. So clearly, you know, I was just in a situation yesterday in a line at a store. I was wearing my face mask, but there was a guy behind me on the phone, and he was really loud, and he was continuously talking, and it really made me uncomfortable, I have to admit. So unfortunately, I couldn't, you know, go to the other side of the but yeah, I would probably try to avoid someone like that if I was able to do that.
So interesting.
Oh, sorry, just one more. Someone else asked, they said, we now have free testing available without a doctor appointment. Is there any reason an asymptomatic person who does not work or live with immunocompromised people should get tested? And I guess I'm not a scientist, but what I will say is that you don't really know who is not immunocompromised. But their question is there a reason someone who is asymptomatic should get tested if they're reintroducing themselves into the public?
So part of the repopulation guidelines that Tulane University is putting in place is that they're going to require testing.
Yes.
So like, I'm going to do it because I have to do it to do my job. Otherwise, I don't think that I would. But, you know, there are decisions made above me that dictate what I will or will not do related to that. So, I mean, I think it depends on the situation that the individual person is in.
Yeah, I think the main point is that you don't really know who is immunocompromised or not in this question. And so I guess if you're reintroducing yourself to a group of people and you're asymptomatic, I think that you still need to follow the CDC guidelines and be cognizant of yourself and your symptoms should you have any.
Yeah. Certainly, if you even have a respiratory infection, like just a cold, you shouldn't go to work. Right? You shouldn't be around people if you even think you have it. But if, you know, there's no way to tell if you have it or if you don't, if you're asymptomatic without testing. So.
Yeah. All right. So for the last few minutes, 10 minutes, I was going to pass it back to you. Sorry.
Oh, yeah. So thank you so much. So I feel like, I don't know how others are feeling. I'm feeling a little bit less stressed with this conversation. I'll try to be a little more reasonable. I'm going to not be in a place that doesn't have ventilation. I'm going to keep my hand sanitizer with me. I'm going to wear my mask. And I'm going to try to be smart about what I do. I'm going to try to avoid loud talkers. And I don't know, any other sort of suggestions as we sort of go into the world, and then we're going to turn to, in the last 10 minutes, we're going to thank you, and then we're going to do one more thing before we get to our next panelist. So any last words before we depart?
There was a question asked about a salt encrusted mask. Yes. That I just wanted to point out a couple of things associated with that paper.
Yeah.
One, it was a mouse study. So they didn't make little tiny masks and put them on mice to figure out what was going on. And two, they had a salt covered mask and a mask that had been treated with a soap solution. And the soap solution mask without salt was equally as effective as the salted mask.
Oh, hold on. We have it. Seeley, can you mute, please? Seeley? Sorry. Okay, go ahead.
So that was all I really wanted to
So
point
salt
out.
you shouldn't dip your masks in salt is what you're saying.
I'm saying that it's probably no better than using a 1% soap solution.
Got it.
Because their survival data for their animals and their viral titers were the same for their soap alone and soap plus salt.
Got it. All right. Cool. Awesome. All right. Well, thank you so much. Dr. Rando, do you have anything else to add before we go?
No. It's been a pleasure being here.
Awesome. And you both wear homemade masks when you go out, right? Am I right? Do you make? Yes, look at that. Scientists wearing masks. See, we make masks and scientists wear them. How cool is that? I love it.
Yeah, so I guess just to close it off, I saw a comment that I think is great. It says, thank you to all the panelists. Follow the 3 C's, cautious, common sense, and courtesy.
Totally. Awesome. Thank you so much for your time. You've given us so much time, both the interviews and here, and it makes a big difference. You're in my thoughts all of the time as I sort of brave myself to get back out in the world. Awesome. Seeley, can you mute again? Seeley?
It's mute.
No, it's because I can hear you, Seeley.
It's muted. I muted it.
Okay, awesome. All right. Awesome. You're awesome. Thank you so much for your time and being part of this. This is really it means a lot to us, all of us, and it really matters. So thank you so much.
For having us.
Bye.
Bye-bye.
Bye. All right. So we have 10 minutes. Bye, Dr. Rando. Thank you so much. So we have 10 minutes. What I thought we would do is go back to that PowerPoint and get ready for our next guests, which are going to talk about the masks themselves. And I think that we need to get prepared for them. So I thought we would do a little prep. Whitney, can you bring that mask, the PowerPoint back up, or do we need Hailey?
I'm going to share my screen.
Okay, cool. And is Hailey around? Do we know?
She is back to studying for the bar.
Awesome. Okay. All right. So let's take a look at this slideshow for just a quick second. We've got a few minutes, and when Dr. Siegel is on, will you be able to let me know when he's in?
Dr. Siegel is already on.
He is?
I believe so.
I don't see him on my list. Dr. Siegel, are you there?
You know what? He's not on. That's my fault.
Will you would you message him and just let him see if he's still good at 12:40?
Well, I'm sharing my screen.
Okay. Oh, you can't. Cool. Okay, well we'll figure that out in just a second. Okay. So, and I can't, can you go to, let's go through keep going. All right, so we know N95, we know surgical, we all made surgical. We know Olsen, some of us made Olsen. Awesome. Bala mask is another one that's just many different versions of these masks. We all know that. And then go to the next thing. Batik, yeah, some of us use Batik. And what I wanted to look at is these two studies. So the first one was the American Chemical Study, and that came out on April 24th. And if we have scientists or other people that know more about this than I do, please let me know, and put some of your comments in the question and answer so Whitney can add to it. So this study took and looked at different combinations. Oh, and Joel, are you a panelist? Are you make sure that Joel, can you join as a panelist so you can have a conversation with us on this stuff as well? Joel Sellers, I saw you as a audience, but I don't know if you're, okay, so go back. Okay, so what they did in this study is they took different hybrid of fabrics. They put cotton silk, so you can see cotton chiffon. They did all these different versions of it. And what Joel and I did was, Joel, and then I helped a little bit, we worked together to try to make all of these pairs so we can talk with the scientists about it. And so I think it's super important for us to understand what fabric and the two things we're looking at, go to the next slide, is, okay, so they tested in this study, they tested 15 fabrics. And they gave us the list of what the fabrics are, so you can go and actually, they bought a lot of them at Walmart and at Joann, and so you can actually see the number and replicate it. And also they tested N95s. Are we good? Somebody just popped in. It's hard to do all of this at once. No, I don't see him yet. Okay. No, not yet. Okay, so then they did some testing. So go to the next slide. Okay, so this is what they started to see, right? Was tighter cotton is better. We know that. We've heard that. They also tested chiffon and other things. And so this concept of electrostatic filtering is one of the things we want to ask our next guest about. The teeny tiny particles, I think, don't like the electrostatic, and they get all weird. And so we're going to talk to them about that. We also saw that they did 4 layers of silk. So when Joel is in, we'll talk about that. She, as I said, she has has the samples of that. So does Whitney. And 4 layers of silk. Weird. Good. Why good? I think that's weird. It's very interesting. Hybrid. They did a bunch of hybrid stuff, and then interestingly, they tested a quilt. So do you have the Whitney? Do you have so go to that, the samples of it. Super weird. So you can see the results here, and what we want to understand are these results, and we can talk to our next guest about it. But you can see that like N95 gets high marks, right? The surgical mask with no gap, this fit really matters. And so what we're looking at are 2 things, filtration and fit. And so what we want to really understand is these things. Now, you can look at the cotton quilt. So if you put like fabric batting fabric, it's a really good mask. I don't know about the breathability, but it's a very strong, it looks like it gets really high marks, 96. Right? Cotton quilt. So you can kind of see, I'm really curious what you all think about this, but you can also see the hybrid of cotton silk, no gap, but look at how much it goes down when it is a gap. So we really do want cotton flannel. They used a flannel that was like 37% polyester, which isn't what we normally use with flannel. Usually flannel's 100%. So again, we want to talk to them about fabrics and other things that they are doing. How are we doing on, do we have our guests yet? Okay. Go to the next slide. Okay. So we got that. So we got this, like, you should do all these combinations of fabrics, and we're going to talk to people about that. And it's super interesting. And again, we made all of these. So we'll take a look at them once Joel is on. And also Whitney has a set of them once she stops sharing her screen. Also, World Health Organization. So we get this next one in June. And they looked at 170 studies and found masks are helpful. They also suggested 3 layers. What? We've been doing 2 layers all spring. Again, they looked at filtration and breathability. And this is part of the study looking at non-medical masks. So go to the next slide. Okay. So they said a minimum of 3 layers is required for non-medical masks depending on the fabric used. Okay, here we go. The innermost layer of the mask is in contact with the wearer's face. The outermost is exposed, so that the mask has different types of fabric depending on whether it's towards your face or outside to the environment. Okay, next slide. Okay, so here's the combination. An innermost layer of hydrophilic material, cotton or cotton blends. An outermost layer of hydrophobic material. Again, we want to talk to our scientists to understand these concepts. Polypropylene, polyester, or other blends. So on the outside, you have a polyester or polypropylene. On the inside, you have cotton. And in the middle, oh, Jocelyn. Jocelyn's here. You're here too. Did everyone, yeah, she's our, oh, cool. Scott's here too. Awesome. Okay, cool. And then the middle one is a synthetic non-woven material such as polypropylene or cotton layer, which may enhance filtration. So we've got these 3 layers. We want to talk to the doctors about that and see what they say. We have 2 incredible scientists and doctors joining us next. Is that the last slide? That was
no, it wasn't.
No, but that's, you get a sense of it. So let's see if we could bring in Dr. Siegel for this next conversation. And did Joel join us too? Do we see Joel yet? Joel's here too. Awesome. Hello. We are so excited to have you. All right, Whitney, go for it.
Yeah, so here we're going to be talking about research on fabrics and with Dr. Scott Siegel, who is a professor of anesthesiology and chair of anesthesiology department at Wake Forest. His research interests typically include using machine learning techniques to improve patient care in the operating room, but shifted to evaluating handmade mask materials during the COVID-19 pandemic. He received his AV and MS-HCM from Harvard and his MD from University of Texas Southwestern Medical Center.
All right, so we are insanely excited that you're here. This is about masks. These next 2 one-on-one sessions are really the heart of our conversation. So get us started. I know a little bit about you. And sort of tell us in your own words of like your context of this and sort of what you all were doing at Wake Forest.
Sure. Thanks for having me. Glad to be part of your symposium.
Thank you.
We at Wake Forest, when we first encountered COVID-19 in the late winter, had gotten word that many of the national supplies of protective equipment might be threatened. At this time, the disease was really centered in Asia, and most American medical masks are made in Asia. And there was a fear that the supplies might become untenable. And so we started thinking about having volunteers who might be willing to make cloth masks for use in a medical situation. And that was our original motivation. And when we started getting the masks from a whole bunch of volunteers, there's an active quilting and sewing community in this area. They varied very widely in their design, in the materials that they were made from, in the shape and size and so forth. And we asked the question, is there any difference between these masks? How do they compare to medical grade masks? Should we actually be using them in the operating rooms if our situation became really dire? And that led us to set up some testing around the filtration efficiency of different masks.
And what'd you find?
Well, our setup is a relatively straightforward setup where we put air with known amounts of particles in it through a mask and measure what percentage of them get across. And we're measuring microscopic particles usually looking at the smallest sizes, 0.3 micron size particles.
And from
a virus is 80 to 100.
Let me ask you a question from our last one so that we can follow along with what you're saying. Are those the teeny tiny particles that you're measuring, or the droplets? The super tiny
the smallest
ones,
particles.
The smallest
These would be like what are called aerosols.
The aerosols.
Viral particles themselves are in the neighborhood of 80 to 100 nanometers or 0.08 to 0.1 microns. We're measuring 0.3. To get down to those nanoscale particles takes a different instrument, but it's typically used for measuring mask efficiencies, is that smallest particle. We also measure larger particle sizes, which would be more like respiratory droplet size in the 5 micron size and so forth. They're still microscopic, but they're not as small. And so we looked at that, and surgical masks did about 60 to 65% filtration, N95 masks, as they should, because 95 means 95%, filtered 95% or more. And cloth masks were all over the place. Right. We had some down in the under 10% range, and we had some that actually outperformed surgical masks, not in 95 level, but in the upper 70s percent filtration. And so that led us to try to get the word out, since at the time, the fury over trying to make masks at home or find masks for use outside the medical area was just getting started. The Surgeon General had changed his public stance on masks. CDC was starting to say that it wasn't unreasonable to wear masks. And so we thought it would be important to get the word out. And so we did a press release and got a fair amount of popular media attention to that.
Very interesting. Okay, so I'm super curious. So what I'm curious about, so what did you think about the American Chemical Study and their work? Did you find that it was similar to what you were finding or not?
It was. They actually got a fair number of cloth masks with pretty decent performance. Yeah. Some of ours were not as good as theirs. And it may very well be differences in the individual types of cloth that were chosen by the maker. I will say that I thought that study was well done. It's an unusual location for such a study. They usually focus on chemistry, nanoscale chemistry. I think the angle that led them to be interested was that it had to do a little bit with electrostatic attractions of particles, which is another way to trap particles with electrical charge. Our setup is actually quite similar to theirs in terms of the testing setup. Yeah. They did add a few nuances that we're actually adding to our setup now to make sure that the number of particles that you're passing through the mask is consistent in the different masks that you test. It helps with reproducibility. But I thought the paper was well done and is actually rather similar to some of our findings. I think that they too found variations in different materials. Yeah. They tested a wider range of materials, I guess I'd have to say, than we did in our initial work, because our initial work was based on what amateur sewists had made for us. Yeah. And lots of different materials were being used, from simple big box store printed fabrics to kind of higher grade quilting cotton kind of fabrics. And it was those higher grade fabrics, the ones that tend to have either or both a tighter weave and a thicker yarn that seemed to perform better in our hands. Yeah. And so that's what we initially transmitted was what one should use. We found, by the way, in contrary to what you were saying when I came on, 2-layer masks were just fine.
They were.
They were.
I think is huge, because we all just sent out, thousands of these 2-layer masks, and to have the WHO come out with 3 layers was very alarming.
To be fair, the 3-layer design that they're talking about really just adds an outer, more water-resistant layer to a typical 2-layer mask. And that's true. We didn't test water penetration. When a mask is approved for medical use, in addition to filtration testing and breathability testing, they also do fake blood going through the mask, and you want to make sure that it resists penetration
that makes sense.
by liquids, because splatter and so forth, unfortunately, does happen in medical settings. Yeah. We didn't test that. Yeah. We were really focusing more on non-medical uses of masks by then. I don't think that's a huge risk for the general public wearing a mask. Yeah. It would be if you were to use them in a healthcare setting.
Yeah. Okay, so did you find, so I'm reading some of the questions, did you find that the high quality cotton was better? If we're going to continue to make masks for friends and family, what is your suggestion on what we do use for material?
So as you and I discussed when we met a few days ago, the difficulty is I'm so used to a medical scientific world where you can get the technical specs on a piece of cloth or a piece of material or a piece of equipment. And try as we did, we could not get any technical specs on the fabrics that were being used. We even tried calling the stores, calling the manufacturers. We could not get really careful, reproducible technical specs to say, here's what you should use, one with this thread count, this weight, this whatever. It just wasn't available. I have since learned that good sewing people know a good fabric when they see one.
Yeah, we do.
They can feel it.
Yeah.
And they can sense the weight and the quality.
Right.
What we came up with is, I understand, I am not a quilt in the sort of higher end sewing community. They say you can tell a good fabric by holding it up to a bright light.
Right.
And if you can see the light passing through the cloth and outlining the individual fibers, it's likely a weave that's too open, either by nature of the thickness of the yarns or the thread count of the weave, or both. So if you can see the individual fibers sort of lit up and outlined by a bright light, it's less likely to be a good filter than if you cannot.
Yeah.
And that's been a reasonably consistent finding in our tests. There's certainly some exceptions that surprised us a little, but that is a reasonable rule of thumb, I think. Anybody can do it. You do have to get your hands on the mask. Hard to do if you're just buying one online.
Yeah.
But you should be able to get some sense of whether it's a better filter or not from that.
We're getting a lot of questions about filters. So did you have a thought about like a pocket and filters? And if you're a pro-filter, anti-filter, what should we do about filters?
I'm filter agnostic.
You are.
I think in the best quality masks that we tested, filters did not add additional filtration efficacy. So what that means is, if it was already filtering 72 or 75%, better than a surgical mask, adding a filter did not seem to improve things. In fact, it made it harder to breathe through. And breathability matters. You want to be able to breathe through the mask. On the other hand, I have certainly seen some lower quality fabrics markedly improved by certain filter materials being added to the mask. So an example that we had is we tested some t-shirt material, which tends to have a very open knit type construction, which is why they're comfortable and breathable, and would not be a great filter by itself. But some medical students made a mask that added to that. It was a no-sew mask, by the way. It was all done by cutting and tying. And they added a pocket where they could put a piece of HEPA air conditioning filter material in there.
Right, how did that
go?
These
are just the kind of thing you would buy at a big box home center.
Yeah.
Be careful taking them apart, by the way. There's sharp metal mesh covering them. But you just take a little piece of that and put it in there, and that worked quite well in our testing.
It did. And you're not worried about them breathing in stuff from the HEPA filter?
Not if it's an air conditioning filter, right? That's meant to go in your house and blow air through it to cool or warm your house. So that's probably a safe material.
Okay.
But I do agree with you. You should be careful about using filters that are designed for other types of environments as something to breathe through. In particular, I do not recommend vacuum cleaner bags. They are designed for a very different purpose, and they require very large pressure changes inside versus outside the bag to get through. And they are too hard to breathe through and may very well have some fiber type material that you don't want to breathe. So I'd be careful about that. We did test paper towel type material. Didn't seem to help us much. We tested coffee filters, which some people had recommended. Didn't seem to help us much.
Dryer sheets? Did you test
I
dryer
did
sheets?
not test a dryer sheet, but I don't like the fact that there's chemicals in there. The dryer sheet has something that reduces static electricity, so it's clever. It might have some electrostatic properties that'd be worth looking into. But I would worry. I'm sure that's not what they're intended for, so I couldn't recommend that. I'm not saying it's unsafe. I don't know. We also tested microfiber cloth, which is a non-woven polyester. And in our hands, like this, like a glasses cleaning kind of material, where it's too hard to breathe through. It probably is a decent filter. Non-woven materials are used in medical grade masks, but it doesn't matter if you can't breathe through it. So we did not find that to be a helpful one. And the last filter material that we looked at was something that got a lot of media attention from the University of Florida when they made a mask entirely out of this material. It's the material that we wrap surgical instruments in before they go into a sterilizer. That material has an interesting property. When you heat it up and get it moist, like in steam in a sterilizer, it has pores in it that open up, and the steam can get through the material and sterilize the instruments on the inside of the tray. But when it cools off and dries, those pores close up. And that's so that it stays sterile on the inside, even when it's sitting on a shelf in a non-sterile area. Well, that material in our hands is really hard to breathe through and had a high resistance to breathing. It does actually filter pretty well. So if you can breathe through it, it's probably not terrible material to use, and it's used in medical settings.
So let me ask you a couple. People are asking about washing. We'll get back to that in just 1 second. So electrostatic, that word's been thrown about a lot, and also the difference between, say, a cotton and a polyester, and do you think the blend, having one layer of that versus, like, is there any benefit to that at all?
Okay, so let's talk about washing. You want to go back to washing?
Either one, whatever.
So we did test a couple of masks that were washed multiple times versus the that had never been washed, and it did somewhat degrade the filtering efficiency, but it wasn't a huge change. I think it's probably better to wash your mask every now and then. You don't have to wash it after every use. If you wear it heavily, I'd say get it washed. If you're wearing it for a 5-minute errand a few times a week, maybe wash it once a week or something like that. I would say use common sense. Anything that you wouldn't, an article of clothing that you wouldn't wear, you probably shouldn't wear a mask either if it's that kind of a level of use. Electrostatic simply means that some particles have a electrical charge associated with them, and that can be true of respiratory droplets and aerosols that might contain bacteria or viruses. The particles can be trapped either by a physical trapping in a filter type material, or can also be attracted to opposing electrical charges. So it can act as another way to trap the particles rather. We didn't test that, but modern medical grade masks do have an electrostatic property in one of the layers that tries to trap particles as well.
And that's why they're talking about polypropylene and electrostatic and man-made fabrics is to get
I think that's right. I think that's right, that may contribute to their efficiency. We didn't specifically test that. It's actually pretty tricky to test charged particles of a certain amount. It can be done, but it's not that easy to do. So we haven't done that. The other question you asked was
electric. I don't remember.
Electrostatic washing, and then there was one more thing. I'm sorry.
The man-made fabric. Man-made fabrics, right?
So most of our masks were cotton because, frankly, most of my sewing folks are quilters, and I think they favor cotton fabrics. Right. But we did test some other materials, some blends, and they seem to be okay. I really don't think it's the nature of the material so much as it is the characteristics of the weave and the yarn, but I can't tell you that for sure. In the ACS Nano paper, they did see some differences between different fiber types.
That's right.
And so I certainly have no opposition to any of them. But I actually, if you don't mind, want to just pause for a minute. There's a great deal of attention on what should I make a mask out of. I have to say that the public health rationale for wearing a mask is to stop or slow or reduce respiratory droplets, which are larger particles, easier even for a less efficient mask to trap. And as such, I would say that wearing any face covering is better than not wearing a face covering. You may or may not be able to see. I'm going to tilt my camera here. Yeah. I'm wearing a button that some members of my department are now wearing that says, I'm wearing a mask for you, please wear yours for me. The public health rationale behind this is if we all or most of us wear masks, we will reduce the spread of the virus. There's a lovely study that's just out in the last week that says even relatively modest efficiency masks, if worn widely, markedly reduce the transmission of a virus. There's now some stories that are getting around the world in internet and news. 2 hairdressers who cut 40 people's hair, and they both were positive hairdressers, but they were wearing a cloth mask and none of the clients got.
It's amazing. So I think that's really an important and a good place. We'll see if there's any other questions, but a great place to end this conversation because we're worried that we're not we're doing more harm than good. But you're saying make the masks and send them out because that is a good thing to be doing, and that tighter weave is better. But whatever masks you're wearing is a good thing.
I think that is a great place to stop.
Yeah, I agree.
If you can't make a great mask, at least wear an okay mask. It will help everybody get the spread of this disease, the R naught, down below 1, so that we stop seeing more new cases. Atul Gawande has been quoted in the New Yorker, big medical safety guy, guru, as saying if we could just get about 60 to 70% of people consistently wearing a mask, we could stop the spread of this virus.
Amazing. Amazing. Well, thank you for your time today. And it's just super meaningful. And I know you're super busy and super important and do all these incredible things. And so we're just really, really grateful for your time because this really matters to us on a daily basis. And I think you've made us feel more comfortable and feel better about all of it. So
it's absolutely my pleasure. Thank you for your interest, and I'm delighted to see so many participants.
It's amazing.
In your seminar.
So we have 100 on now, and we have 500 that have signed up. So they'll get the link. So people that can't be here today, which I thought was pretty remarkable for a 10 hours on masks.
I think that's fantastic.
Pretty awesome.
Well, I hope you all spread the word.
Yes.
Thank you so much. Have a good rest of your meeting.
Bye, Dr. Siegel.
Bye-bye.
Bye. All right. Awesome. You guys awesome? All right. So I told you, I hope you have your sandwiches. I've been eating a little snacking myself. I am super psyched for our next, we haven't even said our things. Okay, hold on just a second. We're running behind. So Warm Company sponsored our previous panel. Warm Company, the batting that we totally love. I totally love them. They'd be so good to us on our project. And they're now back in Joann store. They were out, but the quilters brought it back, so you can get it at Joann now. And then this last panel, see, I'm behind. This last panel was brought to you by Havel Sewing, which is the rotary cutting, and they're really cool. And every time we do an event, because Havel sends us stuff for our events, everything gets stolen, which I think is a really, really good sign when the rotary cutters and the scissors and all of the other things get stolen. So they're also part of our giveaway, and their stuff rocks. They're my very favorite rotary cutter. All right. With that said, thanks to our sponsors. Back to Whitney, and did I get?
Yeah, is Jocelyn? You're here. Are you turning your camera on, or are you good?
It won't let me turn my camera on.
I will do it. And then also we have Joel. Joel, are you still around? I don't know. Awesome.
Yeah. But we're going to let Jocelyn.
Jocelyn's going to start. I just want to make sure that we still had Joel so that we could have a smooth transition. I didn't have to be difficult. Okay.
Or Dr. Jocelyn.
Dr. Jocelyn Songer. Oh my goodness. Our keynote speaker and my very favorite person right now in the whole world. I think about you all the time, and we have 1,000 questions for you. Do you want to do the official welcome?
Yeah.
Yes.
Yeah, so this panel is called The Masks Unmasked, a look at the science behind fabric masks for COVID-19. We're introducing Dr. Jocelyn Songer as our keynote speaker on this fact. She's the founder of MakerMasks.org, a group of volunteers providing science-based mask information and designs to community mask makers by studying and testing them. She holds a BS and MS in biomedical engineering from Worcester Polytechnic Institute and a PhD in speak and hearing bioscience and technology from MIT. Dr. Jocelyn Songer has some slides that she wanted me to present while she goes on and talks about the masks and the fabrics. So I'm just going to go ahead and share my screen, and you'll let me know when you want me to switch slides.
Absolutely, thank you. So it was really fun sort of listening into the last couple of talks, and I absolutely agree that masks are awesome and that perfect is the enemy of the good. And that's the thing I remind myself all the time, that it's not worth trying to make things perfect if you can't get anything done. So like the mask that you have, the emergency equipment that you have with you is, and that the thing that you're willing to wear is always going to be the best mask. Can you, next slide? Before I get started into sort of my background and everything else, I wanted to just take a minute to say thank you so much, because none of us expected as sewists to be put on the front lines of equipment that everybody needs to be safe during a pandemic. But when global supply chains failed, the sewists are the people that stepped up. And it was really, I wanted to put in here how many masks we collectively have made. And it highlights a little bit of the challenge with the science. It's really hard to get good solid numbers on that, or at least I wasn't able to. So it's like some groups have 70,000, 80,000, 100,000, but we don't have any good totals of how many masks are out there that we've made and what they're all made of and all of that. But anyway, thank you so much. You are true heroes of this pandemic and of 2020, and I appreciate you, and I know everybody else does as well. Great, next slide. So I have a couple of slides that I'm going to go through really quickly here about my background. So I am from a small town called Orange, Massachusetts, and it is the home of New Home Sewing Machine. They started manufacturing sewing machines in my town in 1860. So sewing is a part of the culture that I grew up in. My grandma was a seamstress. My mom sewed all my clothes for me as a kid. She also sewed my prom dress and my wedding dress. And I don't think of myself as an awesome sewist, but I don't remember a time when I didn't know how to sew. And my mom and my grandmother constantly lecture me to stop sewing with a lead foot. If I want straight seams, I need to slow down. That's a little bit of the sewing background, which won't sort of loop back in for a bit. Next slide. I know Whitney gave me a great introduction, sort of talking about my background as an engineer. I also have a background as a first responder. I used to be an EMT, and I maintain a current first responder training. So I never leave my house without some personal protective equipment and masks in general. And I always have a sewing kit. It's sort of like an interesting combination of the emergency gear that I always have with me. Next slide. So I was sort of going along with my night life in the halls of academia in the ivory tower, doing engineering and biomedical stuff, and I developed occupational asthma. I was literally allergic to my job. So then instead of just having to use masks for work, I had to wear them for my own health. So I got fitted with N95s and took contamination showers every day, but it wasn't quite enough. And so that's an odd context, a juxtaposition of what the whole world is sort of dealing with now and some previous history that I have with it. And my pulmonologist gave me a choice. I could either keep breathing or I could keep my job. So I left my job, go hike the Appalachian Trail and get my health back. The next slide. And that is when I first started having to MacGyver masks and sort of figure out how to make a face mask that would filter smoke. Because while I was out backpacking trail and the Continental Divide Trail, there were massive forest fires, and I didn't have access to supply chains for face masks because it would be another 5 days until I'd get to town. So I had to figure out how to make do with what I have. And so there of me using 2 layers of my bandana, hoping that it will work to filter out some of that smoke. And for folks that have tried a layer or 2 of bandana for situations like smoke, it doesn't work very well. So that sort of forced me to start improvising through other options with the materials and fabrics I had. And then when I got off the trail, I went out and I did a whole bunch of research on masks and what ideal combinations were. And I think that I purchased just about every single reusable face mask that was on the market at the time. And so now I have a stack of all these different reusable face masks, and I kind of had a sense of what did and didn't work for me and what I liked and didn't like. While I'm on this slide, I'm just going to take a second to mention that the reusable mask that I'm wearing in the bottom of the photo has an exhalation valve. And though those work well in a lot of situations, like for when you're dealing with smoke, they don't work great for infection control. And what we're using the mask for now as a general public, which is to keep our germs ourselves essentially, because the exhalation valve just spews everything straight shot past the filter without using it and into the environment. So that's kind of backstory for me, and as quickly as I can get it out there, I think. But so all of this had already sort of happened, and we started to see supply chain shortages. And I started working with my mom, who's an RN and a risk manager, on researching and designing masks for COVID-19 and trying to figure out what the best available information was and how to move forward, make sure that we could get face masks out to the loved ones in our community. Next slide. So if you were doing research on handmade masks before COVID, pre-COVID, you probably came across the same 2 studies that are the ones that the CDC pointed everyone to that said, hey, it's possible that we might end up wanting masks and not be able to get them in a pandemic. That turns out to have been prophetic. And they gave this one pattern in all of the literature at the time. I could only find one pattern for a handmade mask. It was for an 8-layer cotton t-shirt mask. And calling it a pattern was perhaps a little bit of a stretch. So it's a picture of how they did the ties on it and sort of mentioning how they crisscrossed the t-shirt layers. And so that was the primary article that CDC cited. And then there was another one saying, okay, here are our fabric options: sweatshirt, t-shirt, towel, or scarf. And of those, they said, yes, sweatshirt and the towel do the best. And I looked at that and went, oh, we have to be able to do better than a towel, because towels wrapped around your face are not easy to breathe through and work with. And if you've had the experience of hiking 100 days through the desert with a face mask, you'll know that there's a whole lot more to face masks than whether or not it can pass a particle count. You have to be able to wear it. And wearing really bulky, heavy masks for long periods of time isn't practical for most people. So I kind of looked at that research and went, let's see if we can do better. And then the next thing that was important was seeing what we knew about how COVID was being spread. So next slide. And both the the image came out off. Anyway, both the WHO and the CDC and all the research we have so far suggests that COVID-19 is primarily spread via respiratory droplets. And so the figure here shows, was originally for Ebola, and then is also true for COVID, showing that the droplets spread for up to around 6 feet for COVID and Ebola and other droplet-based diseases. And that if you're talking about something that is airborne, and truly aerosol driven, distance that you're talking about is 30 feet instead of 6. And so the main concern, the main thing we wanted our masks to do was to block droplets. So next slide. And I know that the previous speaker was talking about focusing on cotton masks for the general public and not on the kinds of masks that you need in healthcare settings. And I was kind of interested in bridging that gap. I know in healthcare settings, medical masks are used for droplet precautions. What that means is that depending on how a disease is transmitted, there are different recommendations and guidelines for the precautions that you need to take, both to keep you safe as well as your patients. And so the kind of mask that is suggested for things that are droplet based are usually surgical masks because they block those large droplets that we were talking about. And so this is a quick little anatomy of the mask, and I'm sure everybody knows this part by now. That includes a flexible nose piece to help get you a better fit across the bridge of the nose, ear loops. And I have to put that note in there every time that for me, a key requirement of those ear loops is that they be latex free because of a lot of elastic has latex in it. And a lot of healthcare providers have latex allergies. So there's that. And then the body of the mask. And a lot of the dialogue focuses on particle filtration for the masks. But I want to just point out that for droplet precautions, fluid resistance is a key component of the mask requirements, as is breathability. And the last speaker mentioned, and it's a peeve of mine, is that the way that you test this for surgical masks, if you're trying to do those medical mask certifications, is with blood. So synthetic blood at 80 millimeters of mercury pressure sprayed at it. And so one of the things that I'm hoping to get dialogue on with some of the regulatory agencies is setting up standards that are not surgical masks, so that you don't have to have it withstand 80 millimeters of mercury blood, but that are still fluid resistant. So if you're getting sneezed at or coughed at or somebody spits at you, it's not coming at 80 at that same high pressure. But that is a whole nother tangent. And then one last thing on this slide is waterfall pleats. So I see a lot of masks online and in the news that are worn upside down where the pleats are backwards. So with the nice waterfall pleats, they should fall away from your nose, right? And if the mask is upside down, then that leads to the possibility of things getting caught up in the mask, in those pleats, instead of falling off and away from them. I call those tide pool pleats because they gather things that can then grow in the mask. So, all right, next slide. Sorry. When we're looking at face masks for the general public, both WHO and the CDC now agree that we should be using face masks in general, and that these face masks are designed to prevent and reduce the spread of COVID-19. So you place your face covering on, and you're doing that to protect other people, and they place their face covering on to protect you. And so that's what the intended use is for face masks now. And then the FDA, throwing in a third agency here, says that you need to make sure when you're talking about fabric masks and cloth face coverings that you remind people that they're not surgical masks and they're not replacements for social distancing and hand hygiene. All right, next slide. So this is getting into the data finally. And we've seen in the last couple of weeks, and just in the last couple of weeks, we're getting some studies coming out that say, yes, indeed, the face masks are working. And so not only do the face masks that the healthcare providers and facilities use medical masks. Not only do those help, but cloth face masks and fabric masks also help. And a study of 172 articles is what made the WHO change their mind and say, yes, we do recommend fabric masks. And then just within the week, we got this new study, which a lot of you have probably seen floating around social media, saying that wearing a face mask in public corresponds to the most effective means to prevent interhuman transmission of COVID-19. And that is pretty huge. And they show that within a month, 78,000 infections were prevented in Italy and 66,000 in New York. And then just quickly looking at these graphs, on the left, there's a picture from data from the US that shows the effect of social distancing at flattening the curve. And then on the right, they show the data from New York City, which shows that instead of just flattening the curve, putting in the face mask requirements and getting people to adopt face masks, large scale, crushed the curve. So instead of being flat, we saw a decrease in the rate of infections. So the fabric masks that we've been making, they helped, and they are helping. And the data is finally coming through showing that. And so I want to, once again, thank you everybody who's been making masks and who's continuing to make masks. Like, we are making a difference, and that is awesome and important. Right, next slide. So we mentioned at the beginning that I founded Maker Mask, and these are some pictures of the masks that my mom and I designed as we were sort of going through the options. And the requirements I was looking for were that they be water resistant, breathable, washable, and latex free. And the big difference compared to most medical masks there is washable, because in healthcare settings, traditionally masks are single use, so you throw them away as soon as you're done using them. And that's led to some interesting design features. Now, one of the big challenges for me, because I was looking for those water resistant materials, was balancing water resistant and breathable, because those two things do not usually go along together. Waterproof is not breathable, and most breathable waterproof materials aren't really waterproof. So that's an interesting trade-off. And from my backpacking experience, I'd already done a bunch of research into different fabrics where you can get those trade-offs. Next slide. And I ended up landing on non-woven polypropylene. And like, that's right, it's spun bond. That's the kind of polypropylene you're looking for. And we like it synthetic, not woven. And that's because that combination allows it to be breathable, which is good. Non-woven structure helps with filtration. So non-woven materials tend to do better at the mechanical filtration component of filtration. The non-woven polypropylene materials are water resistant, so they're naturally hydrophobic. And the spun bond nature of the fabric has better structural integrity and is continuous fibers. A lot of you who've been paying attention to mass filter materials have probably heard about melt-blown polypropylene as well. And that's with smaller, more discontinuous fibers, and it doesn't hold up to washing. So the fibers tend to shrink and compress, and you lose breathability. And so that's how I ended up at Spun Bond non-woven polypropylene, which I call NWPP for short, because polypropylene is a mouthful to say 10 times fast. And the other advantage to the NWPP at the time was that I had it lying around the house. So I could source it from reusable grocery bags that I had, or from a whole bunch of other options. Now, I could give 3-hour talk probably just on non-woven polypropylene, how it's made, its features. I think really quickly I'll mention ideally we'd be using medical grade nonwoven polypropylene, which we can't get because of global sourcing issues still. And then my next criteria was food grade nonwoven polypropylene, because it's designed to touch food and gives you some better hazard analysis parameters, essentially. And then other materials that are sort of that heavier weight material. And that there are other materials that look similar that aren't quite as good. So you need to make sure you check breathability, and maybe we can find a time to talk about sort of all the do's and don'ts of how you go about those finer choices. Next slide. So just quickly, the CDC and the WHO both recommend masks. One's on the CDC's webpage. They say they need to be multi-layer masks. They recommend tightly woven cotton, and all of their designs are cotton, which is an absorbent material, which is good at containing users' droplets, so containing your droplets and keeping them to you. And I don't want to talk about their bandana mask design because it drives me nuts. Okay. So the important things there is it has to be multiple layers. You should check to make sure it's breathable and it's washable. And the FDA requires that you can include a label with the skin contacting material, so that innermost layer of the mask, and you include the washing and disinfection instructions. Okay, next slide. This is a whirlwind tour. So for the WHO guidance, there's a lot of discussion about that, and that's kind of going to be the focus for this next bit, is sort of why they recommend what they do. And so they recommend at least 3 layers of mask materials with an outermost layer that's hydrophobic. And that outermost hydrophobic layer is designed to prevent things from the external environment from penetrating through the mask to your nose and mouth. And that's a pretty major difference from the recommendations that we were seeing before this new guidance, which were 100% focused on source control, so containing the user's droplets. And that's still the intended use for all of these masks. It's giving the possibility that you might actually be able to prevent at least some stuff from coming through the other way. And they recommend.
Dr. Songer, can you help?
Yeah.
These words have come up already. Can you help us understand what hydrophobic and hydrophilic are?
Absolutely. So hydrophobic just means water resistant, pretty much. And the way people measure it is by looking at how well water beads up on the surface of material. So if you can see a full bead of water sitting on top of the material, that's hydrophobic. And if the water sort of like absorbs in like a paper towel, that's hydrophilic. And so for the most part, for common usage, hydrophobic and water resistant tend to mean the same thing. And hydrophilic and absorbent mean roughly the same thing as well. And then sort of the distinction ends up being in whether people are talking about property of the material, so either the non-woven or the woven material, or of the individual fibers of the material. So the synthetic materials, for the most part, are hydrophobic, so the threads don't absorb water, and that can be an advantage for a whole bunch of things. And then the hydrophilic, like silk and cotton fibers themselves, absorb water as well. So that answer that hydrophilic, hydrophobic, back and forth.
Yeah, absolutely. I think that's really great. And those are things that we can do at home to test it, which really helps as well.
Right. And so, yeah, just flicking a bead of water at it is the way that I tend to, that's kind of like my first approximation. And then 5 milliliters of water from either from a teaspoon to see if it drains through within 60 seconds is sort of the more quantitative way of getting at that. All right. And so when the WHO guidance is saying polypropylene or polyester, those materials are selected because they've tested them and because they have that synthetic hydrophobic property to the threads. And then depending on the weave of the fabric, right? If you have a knit t-shirt with holes in it that's made out of polypropylene or polyester, then even though the fibers don't absorb water, the material the material isn't water resistant, so the water can go through the holes.
I am going to interrupt again. I think that's just so insanely great. And we're going to be talking to Joe Sellers about the samples that we made. But it gives us a really good, if you look online, if you're shopping, like somewhere like Joann is a good example, they'll say what it's made out of. So you can see it's 100% polyester or even fabric that's 100% polypropylene. And so this is very helpful in terms of really moving forward. So your talk is awesome. So I'll leave it at that, but that this is doable for us as sewists.
Yeah, absolutely. And I mean, we've already talked for 2.5 hours and this is another half hour, but I would love to get the information and have more conversations so that we can bridge some of the communication gaps across the communities and figure out how to think about it.
Of course, I'm going to keep interrupting. I'm really sorry. I apologize. But as we've talked about, and just for the audiences, one of the things is to put out a best practices for the sewing community. And I would love for you to work with us on that. That's very short and simple, that helps understand how to pick the fabric, what the key things are, basically what you're doing, but put it into sewing language so that we can actually have this discourse. Because I really do believe you help us have this very difficult bridge between the science and the sewing community. And you are like our hero in this. So I'll let you continue and take as long as you need, because I think this is super important.
Well, if you told me to take as long as I
know, well, sort of take as long as you need, but right. So take another 10 minutes or so.
All right. Okay. All right. So for that outermost layer, with the waterfall pleats, I think of it as, if you can, you want things to hit it and sort of drop down in a way instead of getting absorbed into the mask and held close to your face. And so that outermost layer, its goal is to prevent things from going into the absorbent layers. And the WHO is specific in suggesting that outermost layer be hydrophobic. For the middle layer, they kind of can go either way. So they say either use a hydrophilic layer like cotton or a cotton blend that will absorb the user's droplets and contain your own droplets, or use a hydrophobic non-woven material which will enhance filtration. And they say that because non-woven materials kind of have a much more chaotic structure and do better at mechanical filtration than woven materials, because woven materials tend to have holes that go straight through in a more organized way. And so if you're used to, doing materials at different angles, right, that mismatch of how the fibers are formed together gives you better filtration. And so that's why they suggest a non-woven in that filter layer, and specifically the non-woven polypropylene. And there's a whole literature on what the different sort of non-wovens you can find are, but that's the rationale there. And then for the innermost layer, as for general use, and actually in surgical masks as well, that inner layer is designed to contain the user's droplets. And so they recommend a hydrophilic or absorptive layer for that, like cotton. All right, next slide. So one of the differences between the guidance that we got from the CDC and what we've heard from the WHO is that the WHO starts giving us actual criteria for how we should be choosing materials for fabric masks. So for the masks we're all creating. And the reason why they select unbound, non-woven polypropylene, cotton, and polyester in specific is because of a new study that came out in ACS on the ACS nanoletters, showing the balance between filtration and breathability. Now, those two things can be measured separately, but in order to kind of look at them both together, they ask you to look at the filter quality factor, because that combines both metrics in one. So the higher Q value, so filter quality, better, and that you want Q values for each of the individual materials you're using to be greater than 3, so bigger than 3. So while we're combing through the scientific literature, if that's a thing that other people are interested in doing, I know it's something I do, that's a criteria that we can look for, say, that have a good balance of both filtration and breathability. Because if you can't breathe through it, doesn't matter how good the filtration is, you shouldn't use it in a mask. And so the figure to the right here shows that breathability data. The quality factor for 3 different cotton materials, a silk material, nylon, which doesn't do very well at all, and then polyester, and the final one is polypropylene, the spun bond nonwoven polypropylene. And they show sort of the initial value, so that's just sort of off the shelf. And then they check to see if you can improve the Q value, so the filtering, with an electrostatic charge. And I know you mentioned this a little bit in the previous talk about what that is. And I think for most people, you can think about it as static electricity. And that's what they test in this particular study, where back in high school physics, college physics, they do demonstrations rubbing different materials against a rubber rod, or mostly a rubber rod, and build up a charge on it and show that the material gets a static charge and keep it for some amount of time. And so when you do that with cotton, it doesn't build up and hold an electrical charge. If you do it with a synthetic hydrophobic material like polyester or polypropylene, not only does it hold the charge initially, so it gets that electrostatic charge, it can keep the charge. And polypropylene was able to do that and keep the charge for longer than anything else. So it's like you can build up the static charge and it keeps it, the charge allows it to do better filtering. And the thing that was really interesting and kind of most interesting about that electrostatic charge part is that they showed that even when it started to get humid, so water usually kills the electric charge, polypropylene over an hour. So it's possible that there might be some practical applications for home users being able to electrostatically charge their mouse. And as an electrical engineer, that is fascinating, and I'm really interested to see how that pans out long term.
Let me ask you a quick question on that, because I don't really understand it only lasts an hour, and how are you supposed to recharge it? And are you supposed to have a bunch of masks with you? Like, that part confuses me.
And I think that is a really, really fair concern, and it's a thing that I'm not sure about either. So they were showing that if you had a pair of vinyl or latex gloves and you rubbed your polypropylene mask between them, that it would build up a static charge that was big enough that even at body temperature and humidity, you got the benefit of that for at least an hour. They didn't show us data about what happened beyond the end of that hour, and we don't have information about how quickly that's going to cause the mask to break down, because rubbing materials tends to cause them to break down faster. So that electrostatic component for home users, I think, is still an amazing, wonderful, fun theory, but the practicality of it still needs more consideration. So I think for instances when you're going to go out for 15 minutes, half an hour to run errands, and then you're going to go back to wherever your safe environment is, it may be useful, but more testing is needed. And if you're going to be wearing a mask for 4 hours, then that electrostatic boost that you get isn't likely to stay with the material the whole time. And the decay over time, I have a slide that isn't in the presentation where I looked at the data that they have for that, and it's promising and theoretically interesting. But that part I'm still leaving on the table as needs more practical consideration. Even without that electrostatic charge and that electrostatic boost, the Q value for the non-woven polypropylene is still high. It's the highest of all the others. So the Q values that I mentioned in the summary are the Q values without the electrostatic charge. And so that puts you with spun-bond non-woven polypropylene as your kind of top of the list, cotton next, and then the polyester somewhere in between. But the nylon wasn't breathe enough, and so that's why they voted no on the nylon, and the silk didn't have enough filtration for them, I believe. So that was kind of how that broke down. Does that clear up more than it confuses?
Yeah, it's great. It's super great.
All right, so next slide. As somebody, so ever since early March, the very first thing I wanted to do was get my mask designs tested. So I did some basic hazard analysis to see if there were any obvious pitfalls, because I wanted to make sure things were safe. And then there wasn't any guidance on the ideal mask and what we should be aiming for in terms of testing criteria for fabric masks. And the WHO guidance provides us some standards that we should be trying to hit in the design of our masks. And so the WHO recommends at least 3 layers. And as the previous speaker was saying, a big part of that is adding that water-resistant hydrophobic material to the outside. So if you have a whole bunch of cotton masks and want sort of bump them up into meet the WHO requirements, the only thing that you need is to add a layer to the outside, or a mask cover to the non-woven polypropylene. Then in terms of mask filtration, they say that for fabric masks for general use, you should be aiming for 70% filtration efficiency. And so it's nice to have some numbers there for what's reasonable to get. And part of that is that the extra boost that you from a filtration efficiency of 70%, 95% is with the electrostatic. And as we just talked about a fair amount, we're not sure how practical that is for handmade masks yet. It's good to have a number there. And then for breathability, they suggest that you need less than a 40 Pascal pressure drop across the mask. Now, that's not a thing that's easy for us to test at home in terms of a 300 Pascal pressure drop. When I get there, I have some data that I'll share, which shows that cotton masks and the cotton non-woven combinations that we're using do meet this criteria. And for home users, I recommend putting your materials or your combination layers on the end of a toilet paper tube and blowing a ball of lint through them so that you can test the breathability without actually having to put the mask up to your mouth and sucking air through it. I can talk to you later about the mask filtration test that you can do at home, but for the masks we're working on.
Yeah, can we talk about that now, just so that we make sure we get to that? Because I think that's really important for people too, unless you have it in your slides later.
No, I don't, and I know we're running on time. So for the filtration,
we're good. This is super. This is we're good. We're good.
All right. So for the filtration, we don't have access to the same fancy equipment the big testing labs do. We do, however, have access to our kitchens. And for a lot of foodstuffs, they have to calibrate the size of the particles. Because for those of you that both bake and sew, you know that having your baking soda and flour and and baking powder, the right sizes, the right density essentially makes a difference. And so I sometimes get baking powder and baking soda confused, so forgive me if I get it wrong, but it is the baking powder as particle sizes that are calibrated at less than 50 microns. So it's not the same as 0.3 microns or 1 micron or 3, but you can actually find things in your kitchen with particle sizes that get you down into some of those smaller micron particles that are relevant. And it can give you a sense of how well they're doing. So that was kind of my home test, because getting the particle filtration has been a challenge. But if I take the material, same toilet paper tube that I used for the breathability test, and put it over the end of the material, then for loosely woven cottons, you'll see that the baking powder just shakes right through and makes a mess if you're doing it on, say, a piece of black paper.
I'm so excited.
But if you use a more tightly woven cotton or 2 layers of it, or the non-woven polypropylenes, you can see that you don't get as much going through. And there are a bunch of other sort of DIY home tests that people are looking at to try to get at that same small particle filtration.
And so this is why we're so excited about this, because this is just the beginning of the conversation, and we have a ton of questions about what about Gore-Tex, what about all these questions. We are going to be working with you, hopefully, if you're willing, to help people understand what these tests are, and start to really think about the combination of fabrics that are out there. Again, about filtration, breathability, and cost, because one of the studies had said silk, and it was like, are you kidding? That's like $40 a yard. That's ridiculous. So, again, thinking through all of this. Let's continue. We're starting to, we're getting a little behind, but this is super, super important. And we have a part 2, which Joel Sellers is gonna, after you can finish, we want to show you the masks we made.
All right. So I'm actually I only have 2 more slides. So washing is one of the big differences. So fabric masks, we're designing them to be reusable and washable, and that's a pretty big difference from what we've seen in the medical grade masks. So the requirements for washing and how we do that are important. And so the WHO guidance references a French standard, which says that you need to make sure that your mask can hold up for at least 5 washes. And so that's kind of a minimum there for reusability. And then they suggest you need to be able to wash it at temperatures of at least 60 degrees Celsius. I have a whole talk on just the washing, cleaning, and disinfection methods. Both the WHO and CDC recommend washing at the highest temperature you can. And the WHO further goes on to say that you can boil or steam combinations of cotton and non-woven polypropylene. And that's important because that gets you a higher level of disinfection. So a lot of people, and I hear it all the time, it's probably, I spend way too much time sort of fielding questions about that. But COVID and some of these other envelope viruses are somewhat sensitive to heat. So you don't have to have highest heat ever to kill COVID. But when you're talking about a fabric mask that you're putting over your mouth and reusing, COVID isn't the only thing that can grow on that, right? or can accumulate on it. And so for some of the bacteria and fungi and spores, I'd like people to at least consider you might want to periodically be killing off everything that could be growing in your mask and not just COVID. So that's something to keep sort of in the back of your mind when you're thinking about how you're washing and cleaning things. And then you're putting things on your face multiple times. Detergents become important as well, because it's kind of one of the biggest hazards with laundry in clinical settings is the buildup and accumulation of detergent residues, which commonly causes skin allergies and irritation in people. So fragrance-free, low residue detergents.
We have a question about, couldn't you just wash the mask with hand soap for 20 seconds like you wash your hands? How is it different than washing your hands?
So when you're washing your hands, your skin is a fairly impermeable surface, right? So water doesn't absorb deeply into your skin. And as you wash, what you're mostly doing is you're rinsing everything off of your hands and flushing it down the drain. So that's one of the big differences, is that when you're dealing with cotton or absorbent mask, or even a multi-layer non-woven polypropylene or any multi-layer mask, then you need to be making sure that you're getting at all the area that's in those in-between layers and through all the seams, and and just penetrating deeply through all that and anything that's gathered in the pleats. I think I mentioned that before, but things can get trapped in pleats and seams and all of that. So that's one of the things that makes it different from just rinsing your hands off, because that rinsing is important.
Got it. We have another question about, can you iron polypropylene, and are you worried about that?
So the short answer is you can iron it at the lowest setting of your iron. If you do it at a high setting, it will melt, because irons get very, very hot, as we all know. And I have a table somewhere where I actually mapped out, I think probably it's in the disinfection post, cleaning and disinfection post on Maker Mask, where I went through the different temperatures that your iron gets versus your dryer versus your washing machine. So at those high temperatures, it can melt. If you're at the lowest temperature, it's probably fine. And there's a lot of data sort of backing that up. And the other caveat there is, this is for the spun bond 100% polypropylene. If there's a mixture of other materials in there, so polyolefins, which is a name of a class of materials, often include polyethylene, which melts at boiling temperature. So if there's any polyethylene in the fabric, it's going to melt and shrink, even at the lowest temperature setting on the iron. So make sure it's 100% polypropylene. And I actually have some data on shrinkage. So the non-woven 100% spun bond polypropylene doesn't shrink at all at 450 degrees Fahrenheit across. I tested 5 different cycles of steaming. The polyethylene, it shrunk by 20% in the first steaming. So it was a huge, very noticeable effect.
Okay, so we are also bringing on Joel so that I know you have 2 more slides. We do have a question about, what about spray with alcohol spray? Could you spray the mask with that? Is that going to do anything, or washing is just the best way to go?
I vote washing, boiling, or steaming. So those are the preferences. Whenever you start spraying chemicals onto it, you have to be real careful with residues and what you are then inhaling. And for the different materials, it also, those solvents can break down the materials more quickly. In general, I don't recommend it. If you are getting a mask from a manufacturer that suggests otherwise, then that's a consideration. You can follow the manufacturer's advice. In general, I say no. And while we're in this sort of washing vein, just briefly mention UV sterilization, because a lot of people are getting little UV boxes to put things in to sterilize them and disinfect them. And I don't recommend that for masks. It's good for materials that are hard and not porous, but masks have multiple layers. And so the known challenge is that the UV doesn't penetrate through all the layers and all the seams as well. So in general, it's not recommended because it can't get to those middle layers.
You are insanely great. So I know there's 1,000 questions, but the thing that's so cool about you is you have a website, which is makermask.org, and you have a ton of this information and more on your website. So let's continue with the PowerPoint, and then Joel Sellers, are you there? Can you come on camera for us so we can show her what we made?
So it's just one more slide, which is some data that I haven't managed to, if we can go to the next slide, data that I haven't managed to get up onto the webpage yet, which is breathability testing. So we've got some breathability testing up on the webpage for the Maker mask cover, which is a single layer of non-woven polypropylene on top of an N95. But we've also tested the Maker mask fit, which is a fitted design, and have breathability showing that for less than 5 layers of the non-woven polypropylenes we use, that worked out. And then the data we have showing the non-woven polypropylene and cotton combinations. So I've got a picture of a whole bunch of Maker mask surge designs, as well as some of the craft passion designs, looking at the breathability for 3 layers of non-woven, 3 layers of quilting cotton, and then combinations of non-woven and cotton. And we haven't gone through and managed to get that data published yet, but all of those combinations were breathable. So that sort of reinforces you can do your 2 layers of cotton and a layer of non-woven polypropylene on the outside, and it comes out fine in terms of breathability. And the WHO guidance, if you actually dug through and read all their references, which I did, they actually show data showing that the filtration meets the new WHO standards with those combinations.
That's so very cool. Okay, so we have been sewing. Joel and I decided that we were going to take all of the information and try to sew them. And so Joel is standing by with, you ready to hold up some stuff? So right, so we did the silk. So tell us what you did, and we're psyched. We made 2 sets, so we can see some of the
we made 25 different combinations of things.
Right.
And Elizabeth told me to listen to you before I did it, but we did all these combos, and there's some of them now that it's like, it was a waste. But what it really helped with was looking at what was easier to sew.
Right.
The slippery stuff was all hard to sew because, of course, we're going, you said, take your foot off the pedal, but you're trying to do it quickly because you figure this is not fine sewing.
That's what I do. Yep.
The 2 and 3 layers of the polypropylene were tough on the needle. I mean, I went through needles with that. I think it even broke Elizabeth's serger.
I fixed it. It's all good. I fixed it, but it's good. Yeah.
But it was, it's heavy. It's heavy duty stuff. So you have to take that into consideration. I switched to a jeans needle, so that made that easier.
Right. And we have a needle recommendation up on the website as well.
Awesome.
For like the 16. I'm not sure.
Yeah. I think the jeans is something like maybe even an 18, but it's a pretty heavy needle.
And then adjust the foot as well, so it's not as
high.
Yeah.
Yeah.
Well, the other way, I think. Yeah.
Give it more room.
But the
ready?
The combinations were okay. We did a lot of. We ordered a bunch of fabric. Anytime we saw polypropylene, some of them were woven. Like this is a woven polypropylene.
Yeah.
And those were exterior fabric.
Right. So they weren't
like,
great, right?
Like Sunbrella and stuff like that.
Yeah,
sort of. There
like
were
to cover.
Some that were actually solar. They were like this is a solar fabric. It's a very, very tight weave. You couldn't see through it.
Right.
But it's woven as opposed to non-woven.
Right, and a lot of those have UV coatings on them, so that's another flag.
Yeah. Oh, yeah. Well, I don't recall at this point. You're right, though. If you look on we got a lot of this stuff through Joanne's, and it had all of the information about it. So I'm sure we weren't looking for UV code or wasn't paying attention to UV code, but I'm sure it's on there. So you're thinking that this may have chemicals that are probably not the best thing.
Yeah. So a site that often gives that information is Sailrite, which I've used when trying to source materials for outdoor gear, because they often go into that. And I know that they have one of the lighter weight polypropylenes. I haven't ordered from them yet, but they go into a lot of detail on the
And
materials.
it's Sale, right? S-A-I-L?
S-A-L-E?
S-A-I-L-R-I-T-E.
Sale. Okay.
Yeah.
Well, actually, one of the easiest, and in fact, probably the least inexpensive, was the Pellon 915. It's a non-woven, not an iron-on, a non-iron-on Pellon.
Yeah.
And Elizabeth, it was just less than a couple of dollars a yard.
Yeah, it was like $1.70 a yard. It was
it's
great.
not super wide. It's like 36 inches, like interfacing is. But it sewed very easily. It was not a problem. It's very breathable. It's very comfortable because it's light. So what I wasn't sure about was durability. On all of these, we put on all of them except those that wanted just like 2 layers of silk or 2 layers of satin or something like that. We put some sort of a quilting cotton on the inside because when we're looking at comfort, it was like, I can't wear that scratchy stuff next to my face.
Right, and if you can't wear it and won't wear it, then it's not worth it.
Exactly.
So we're getting a lot. We're getting a lot of questions about interfacing. Can we talk about that? And is the thinness a problem? Because we could put like 2 or 3 layers of it. Is that better than thickness? Like thick versus thin in terms of polypropylene, and we didn't know.
Yeah, so the thicker stuff tends to hold up better and longer. So if you're putting it through the washing machine, I recommend putting them in lingerie bags for reasons we went into in greater detail. So I tend to like to do an outer layer that's one of the heavier ones, but what the WHO study data and guidance show is that one of the nice things about the lower weight polypropylenes is you can layer them and you keep the same Q value. And they specifically talk about interfacing. So the material that they're using is, I believe, I don't remember if it's 30 GSM or 40 GSM. I think it might have been 30. Which has that really high Q value, so good for filtration and particle filtration. And that when they added 5 layers of interfacing together, that's 30 GSM each. So that's a total of 150 GSM essentially. It's still lighter weight than a lot of other materials that we're looking at. It's
amazing. I mean, really, I don't know how.
I saw a comment where someone. Yeah. I saw a comment where someone thought that this was polyester, and many interfacings are, but Pellon 915 is polypropylene.
All right, I'll have to look into it.
Well, that's what Joanne says it was. So it says 100% non-woven polypropylene.
Do you know what the GSM of it is? What the weight of it is?
No, we can find out though. We'll find out. So
I was going to mention that's a thing that we can test at home, which is really useful in having conversations between sewists and scientists, and even across, people. Is you can get your kitchen scale if you have a kitchen scale, or you can get a kitchen scale, and it'll measure grams down to 5 grams or less. And so you take your square of fabric, and then you see how much it weighs for a given area. So either ounces per yard square or grams per meter square, and then we can at least have one of the parameters the same between
and
us.
What are the goal? So you're saying by doing a bunch of layers, what's the goal on the grams to get to?
Well, so they don't give you a goal on grams to get to. They're trying to get a certain total particle efficiency.
Got it.
So they know from the Q value that you can layer it together and you keep the same ratio essentially of filtration, breathability, but to get 70% particle efficiency, you stack the layers. And so the more layers you stack, the more filtration you get with these non-wovens, which is helpful. And they tested 5 layers.
5 layers. And you could easily, I think, Joel, you could easily do 5 layers with the Pellon. It's so thin.
I can certainly try it, because it gets to where trying to make the pleats gets a little bit tricky when you have lots and lots of layers and it's very heavy. So that's where your sewing gets problematic when you're going through so many layers.
Right. No, so I've made a few with the 5 layers of a 40 GSM material. So that's 200 GSM total, which is less thick than just the shopping bag, that 3 layers. Mm-hmm. And it is the most breathable mask I've tried. So I'm really excited. I sent it off to get particle testing done on it.
Very cool.
And we'll see. But I don't know if it'll make it through those 5 wash cycles.
Yeah.
Right, and how the properties change over time with washing, and that's still an open question that we may be able to help solve together if we can all get coordinated so that we're doing the same sort of home experiments that we can all do, and we share our data with each other. And there are a lot of us. If we're coordinated. We can change the world.
Seriously.
And we have so data to prove it.
That. Right.
We have changed the world.
We have changed the world. All right. We're running out of, we can take as much time as we want. Say some more.
I see your shopping bags there behind you. Yeah. And when Elizabeth said we're going to make this out of shopping bags, I thought she was out of her mind.
Everybody does, yeah.
Yeah. So this is 2 layers of the shopping bag and 1 layer of quilting cotton. And it's really not a problem. It was, it's fairly easy to wear.
Easy to sew. I didn't have a problem with that.
It wasn't bad to sew. I mean, like, again, it's a little stiff and all that. I think if you try to put 3 layers plus cotton, every time you add a layer, it gets a little more difficult. But, I mean, our comment was, well, gee, our little cotton masks are so much prettier. But so that's a minor detail.
We say it's a minor detail, but humans are social creatures, and we like to have flair and ways to express ourselves. And so as an engineer, I'm like, I just want it to be functional. I don't need it to be beautiful. I've got different colors. I can select different colors. What more could you ask for? But my mom gets that extra flair in there with the cloth ties. And if you have a cloth material on the inside, a cotton with a pattern that you like, if instead of rolling it in to have the nose piece, if you roll it out, have the channel, so then you get
nice. I like that
color across the top and the bottom.
Very nice. Like that.
I noticed I hadn't seen your design until I'd made all of these things, and I thought, well, that was an intriguing. I like the way that it's for the quilters among us, it's the binding, the backing coming over to make the binding kind of a thing around it. So
exactly.
Bring that color over in.
And that's how they do it in the commercial masks for people that are like
thinking
about it, is that they have the backing from the binding.
Hardest thing about stuff like the silk mask and the when I was making things, because I'd never heard of using silk or chiffon. So we made some with the silk and chiffon, and it's just, as always, you got to pin the heck out of them because they're slippery. But
the only way I could make silk work was hand sewing it. So I hand sewed the silk ones. And so I have some that are 2 layers of non-woven polypropylene with silk on the inside instead of cotton on the inside, which meets the WHO criteria. And the silk and non-woven generate their own sort of electricity. And I don't think it's enough of an effect for it to be noticeable or meaningful. But in dry conditions, it works. And it's soft and comfortable, but I find that the silk is, for me, both the silk and the cotton end up feeling warm because they're just absorbent and trapping that moisture by my face. But it feels really nice when I first put it on, and if it's cold out, I'm not worried about it being hot and being active.
If we have to wear masks in the winter, we have flannel ones, which we will never wear down here.
Show her the cotton one, the quilt.
Oh yeah, the quilted one. I mean, it's like I didn't have any old quilts to cut up, so I just quilted a couple of inexpensive pieces of fabric, but I wasn't sure why to wear quilts, but anyway.
So the rationale there is, so in both commercial masks and the WHO guidance, they ask you to put in a non-woven layer in the middle because it does well for the particle filtration, and that remains true. It's just, you then have a 2-inch, 3-inch,
right.
You've got the batting.
So I like some of the comments we're getting. The costumers are like, we're pathetic as quilters that we can't do chiffon, that they do it all the time, and silk. And you're totally right. We're like, if it's not flat and cotton, we don't know what to do. We also have Maddie from Quilt Smart saying that they are a company that did cotton, where you can do their, it's a pattern, it's printed on it. And so she wants to send you some of that to test it and see what you think.
That was really, I thought that was fascinating. You panels with now, does it make any difference? Because I know I've seen this question. The difference in the pattern for the mask. There are the 2-part ones that with the seam down the center that, is more fitted around the face versus the rectangular with the pleats.
Right. And so the standard that the WHO references, which is French Standardization Association, which is AFNOR, they have strong feelings about that. And they say you should not have any vertical seams in the middle of it. Because if you're concerned about all the particles that may or may not be going back and forth, having a seam going straight up through the middle and the center area of the mask has holes from the needle, right?
Yeah, right.
So that's one of the advantages of pleated masks, is that you don't have seam line up the middle. Now I'm sure the costumers are going, we can do seams up the middle that aren't going to have air leaking through the threads. And as an outdoors person, I have a lot of experience doing waterproof seams. So it is possible, but if you do have a seam up the middle, you want to make sure that things aren't leaking straight through it. And so the quick home test I do, which I'm using water resistant material, so that makes it easier, is I go to the sink and I see if there's water dripping through seams. And that's not nearly as small as the 0.3 micron particles that, higher level masks get tested with. But that's the concern there, is that you're losing efficiency by having holes going up the middle. And, there are wax threads that fill those gaps, and there are ways to seal seams and do waterproof seams, but they're not well tested yet for face masks. So,
let me ask you a quick question. This is so insanely great, and we really want to keep working with you. And there's a ton of people that are asking 1,000 questions, and really the goal is to take all these questions and the samples and think through sort of all these things. And we would love we'd love to work with you, and also put out something that is really made for sewing community, because that's really important to us, to know these things.
And, oh my God, I should have met you at the beginning too, because. Totally. I'm an engineer and I've done the research and the science, but being able to communicate something as an engineer to other engineers is different than being able to communicate it to sewists. And so,
you've got 100 of us on here who are like, you are our new God. We worship at your feet. We think
like,
you're
oh my
amazing.
Gosh, you can make patterns for things that I have.
We're so amazing.
Designs and ideas for, and the stuff that people told me was too complicated and nobody could ever sew that.
Yeah, we can do that.
And I'm like, but I can sew it, and they're like,
no, we're good at that part. One quick question on these masks, and we're getting close. We're only 10 minutes. We're 25 minutes late. That's okay.
We're not 2 hours late like last time.
We're not 2 hours late. Yeah, so we did an interview. It was supposed to be 20 minutes. We went an hour, and then we took a dinner break, and we did another hour and a half. So we knew this was going to happen. I should have put it in the schedule this way. But so one of the things with masks is we see, and our next panel is a little bit harder panel. We'll talk about, it's a more sensitive panel, a social panel. But we always see I wear a mask, I protect you, you wear a mask. These masks seem to protect me a bit more than just, am I right about that? That it's also protecting? I think that's a good message personally that we should be getting out there. That it isn't just about, I don't know. I find that messaging a little problematic.
So we have now stumbled into the ethics of mask making, and sort of there's the science, which suggests that there may be some added protection and added value. And that's one of the big differences with the WHO guidance and using these hydrophobic materials is that it may offer you, I won't say the word protect because cautious, but it may act as a bit of a barrier. But to say that it is protecting you, that's claiming something about the mask.
No, I get it. Yeah, no, I get it.
We haven't proven it. We don't have the science to prove it. But I designed it with that in mind, right? The fact that I used to be an EMT and am a first responder, and I didn't want bodily fluids to go from one side of the mask to the other side. And so that's why I focused on those water resistant materials at the beginning, because I was used to thinking about you get in blood, synthetic blood, or even spit or anything on a mask, an absorbent material, then you end up with it on your face on the other side, right?
That's gross.
And it's gross. And so we had this wonderful set of memes, which I wanted to have catch on, of dogs licking faces. So like the dog licks the non-woven polypropylene face mask, and you don't end up with dog spit on your face.
I just want to say that we have engineers and textile scientists and chemists listening. They are, they say, I'm an engineer. This is Becky. I'm an engineer and I'm a sewist, and we'll get the info out. You have got a team behind you that love you and are just so excited that you're here. Seriously.
I mean, if we can work together, we can. And get that and develop things together, because that'll be amazing. And
we're totally.
There's so much stuff that we can do to get things tested and to make things better. And we're not perfect yet, and there was some mention of that before about, the masks are all better than no mask. We know that.
Yes.
But that shouldn't prevent us from continuing to work to be better. So for this pandemic, droplet precautions and droplet protection is effective, is working, which is awesome. And we see how far we'd have to go from where we are to something that does better at particles. And that's a thing, that's a goal. That's where I started. We need more testing. We need better testing. There's just so many things for us to get better at, which is exciting a lot of the times and is sometimes daunting and overwhelming.
Well, I have been told that if we don't stay on track, they'll kick us all out of the webinar. So we are going to, that is technology for you. We have no control. This is the beginning of one conversation. We have everybody's email. We're going to connect to people. You have an army. We will work with you. We love you. Thank you so much for your time. I am just, see why we have you, why you're a keynote. You are seriously, we follow you anywhere. Seriously, right, Joel?
Well, and it's just really great to have all of you on board. And I want to say, I'll wrap it up real quick with thank you to everybody who's
saying thank you to you and
pouring their hearts and souls into making masks and getting them out there. And data now shows that we are making a difference. And as more data comes out, hopefully we'll be able to better and better. And it's really great.
One quick question. Can we put a couple of pieces of polypropylene in all those filter areas and just sew it back up? Like all the ones that we've made, are you okay with it? I know it's going to have one on the outside, cotton on the outside, but we've just got a lot of these already made with holes in them. So
I don't think I'm quite following the question. You're saying if you rip out the seams and then
we'll just add the polypropylene in the filter and then sew them up. So that the ones we've already made, it would have cotton on the outside, polypropylene, and cotton on the inside.
I'm okay with that.
Okay.
Yeah, so we talked about this.
Yeah, we know. I know. I just want to let people know because we got a lot with filters in the middle, and so we got to sort of figure out how to adapt those. And then going forward, we'll do the polypropylene on the outside, the cotton on the inside. Right. But we've made hundreds of thousands of these right now. So
I know we need numbers on that.
So I know. Well, we're going to work on that. We're going to work on that. That's part of our.
You've made 1 million face shields, but we've made 50 million.
Right. Exactly. Well, that's part of the next part. I beyond adore you. We will be in touch with you. You are seriously. Thank you. You have to. It's amazing. We all love you. We all love you. You've got a whole bunch of love coming to you, and we thank you for all your time.
Former EEs, Science Nerds Unite.
Exactly. Yes. Yeah, fangirling. It's awesome. Okay, so if you want to stick around, we're going to have a little bit of a harder conversation, but it's a really important conversation. Yeah. This is our last panel, and Saru is reluctantly willing to have this with me. She's my colleague. I'm going to bring her on now, and that's really sort of like why it's just so we've had such a good day. We're going to end on a little bit of a hard note and sort of what we do here. And Dr. Songer, if you're willing to stick around too, that would be great.
Yeah, I'll stick around.
Look, we know there's social unrest. We know Black Lives Matter is out there. We know that masks got politicized. These are not easy conversations to have. But as Whitney and I and Hailey were planning this, we realized this was part of the conversation. And so, Saru, are you in yet? Can you come on with us? Saru is my colleague who I talk to regularly because she's one of my very favorite people. And she was like, Saru?
Oh, this is Whitney. Just real quick, can Joel and Dr. Songer turn off
Dr. Songer is going to stay with us just in case if she wants to chime in. Do you want to chime in? No, she's gone. Okay.
Oh, I just asked them to turn their cameras off.
Yeah, you want to stay? Just stay. And then, and Saru, are you there? Saru.
She's unmuted.
And
does she have the ability? Did you give her the ability to turn her camera on?
Mm-hmm. Yeah, turn your camera on. Okay.
Hello.
Hey, Saru.
Hello. Hi.
All right, Whitney. Do you want to? So we are going to have we are running late, and we're going to get kicked out. So we want to have a conversation. Right. Technology is awesome. So we've had this great day and masks and but I have to also bring it, as we were planning this, Whitney and I were recognizing that masks were suddenly getting politicized and people were protesting in the streets and people, it was all getting weird. And we as SOAS really weren't at that place. We were just making masks to make people safer, right? To make our world safer. And then suddenly the world was kind of all topsy-turvy, or I don't know, it got crazy. And you were really kind to me when we were messaging back and forth, and you started to say, why? I was like, why? Who are we, and what are we doing? And so you started talking about the culture of caring and who we are, and I just thought we needed to have that. We needed, even though so we're going to have a short conversation about sort of our current very difficult political time. And for those that feel uncomfortable, that's okay. We're having a conversation, not a fight, and we're trying to understand this political moment. And Saru, this is her specialty. So Saru, thank you for coming. And I know this isn't I know this isn't like you're doing it for me as a favor. But both Whitney and I felt like we needed to have a little bit of this conversation because we're in this space that we're in. Is that right? Am I doing an okay job on that? Does that make sense? Saru, did we lose you?
Sure.
Okay. And Whitney,
sure,
why don't you stay on camera too?
Yeah, so I think it's also just figuring out why why socioeconomic communities and minority communities, or lower socioeconomic communities and minority communities, have been strongly affected by the virus and the historical and cultural context to that. So I'm just going to go ahead and introduce you to everyone. This is Sarah Matimbandazzo. She is a Tulane professor and nationally known author on gender equity and workplace equity. Her scholarship examines issues through robust engagement with critical legal theory, feminist theory, and questions of legal personhood.
And Saru, you are so much more than that to me. So tell us what your thoughts are about all of this. And we've had such a good day, and I really want to sort of have the conversation to understand sort of this very difficult topic in just a short period of time.
Yeah. So I mean, I think this is a difficult conversation,
It is.
and I want to place homemade masks making during this global pandemic in a larger theoretical and political context, and help people understand that just as women who made masks were responding with care to a pandemic, to an illness, to a sickness, people in the Black Lives Matter movement who are using the mask to protest on the street, in a movement founded by women, by the way, women and femmes founded both of these movements as far as I'm concerned, and I'm going to talk about that a little bit, are responding to a pandemic of institutional racism and a pandemic where people have been murdered in the streets pretty much with impunity for about 400 years. And they're responding to that from a culture of care. I have like 3 kind of points I want to bring home today and talk about to try to put this in context. And I want to thank Professor Townsend-Gard. I want to thank you guys for listening, and to thank Whitney for all her work, and and thank everybody for making masks. Right? I mean, the mask I wear around is one
I sent you
that Elizabeth sent me, and not only she sent me so many masks, she sent me like a handful of them. Right? And so I had friends staying with me from home who now wear her masks, who she doesn't know, right, in other places. And I was like, oh, here, take these take a mask. We have like 10, and so, I wear one of the masks made. And so she's never allowed to go out. She never is allowed to go out, but okay. And she also, so I really appreciate it. And I want to acknowledge that many men so beautifully and wonderfully and skillfully, and that gender queer and non-binary people who don't identify as femmes or women make masks. But as a goal matter, as a fact, women and femmes make masks. Right? Like if we count up who are the women and femmes make masks, I think that is right. And I think from the participation in this call, I think that's probably true. Women and femmes in relation to others made masks on the basis not of might a lot of times, but on need. Who needs a mask? I will make you one. I will act as if I'm your mother, your sister, your aunt, your grandmother. I don't even know you. I will make you a mask if you need a mask. Right?
I have to say, and Saru, I have to say that is so powerful to me. Like, that's what the community did. Like, we all using our own time and our fabric, and like we were like, all of us were like people we like barely knew, didn't know, family. Like, we stopped everything else we were doing and we sewed. And that to me is just very, and the way you said it just was so profound. Every time it gets me, I always get teared up when you talk.
It's a gift economy, right? And gift economies are not one-to-one time. People gave their time, their labor, their money to engage in care work for people they didn't even know. So I want to understand the mask making process first as women and femmes made masks, right? And they engaged in this economy of care. And second, that the economy of care is deeply political. And one of the reasons why the economy of care is deeply political is because women and femmes who make the masks are expected to do all sorts of care work and all sorts of things to make up for social political shortfalls that the men who govern our country and govern our institutions perpetuate, right? Women make the masks when men screw up. I mean, I think that this is, I know that's controversial. I know people are going to be uncomfortable with that, but I want you to understand that women stepped up to make personal masks, whether they're, as effective as they could be, et cetera. It's better to have a mask than not have a mask. And they did so whenever the systems of care failed us. And when men in power failed us. And I want to be clear about that. And I have more to say about that in a minute.
Yeah, and I think also to understand that, Seth and I started Million Masks a Day because he's a Republican truck driver and I was a feminist, Democrat, academic, right? But we came together because it was all about, like, put your politics aside. We need to make masks because people need masks. And I think the mask community, we felt that way. We still feel that way. And then things got politicized. So again, this is a really hard conversation to have because we've had such a good day. And I adore all of you. So it is not anything, like, we want to understand sort of the political and the social and the gender aspects of what's happening and the social concepts and the social justice issues that are happening. So that's why we're having you here. I'm so worried about time.
And I think that's one of the hardest things to deal with. And I'm going to talk about a little bit, but I want to talk about the third thing that I want to kind of get out, and I'll talk about these things all in a little more detail, is that economies of care that animated the Million Masks Project, those are the same economies of care that animate the Black Lives Matter movement. It's also a movement started by women and femmes to deal with a pandemic, right? A pandemic of racism, and to deal with a sickness related to the carceral state of the police. I don't think that necessarily individual officers are, at fault, or, individual, this is about systems, right, that fail. Women made masks to address a systematic political failure, right? The Black Lives Matter women, the women who started it, because it was women who started that movement, mothers and women who started this movement, are addressing a systematic racial failure. And I think they're animated by the same economies of care and the same feeling that, every person matters and every person counts and every person should be accounted for. So, those are the three things I wanted to kind of put out. And so, I'll start with asking you, as part of feminist praxis and consciousness raising, I'll ask you, why do people make masks, right? Why did people make the homemade masks? Yes, I know there was a global pandemic, but why did people do that?
If you can, if you want to respond in the chat, because we can't add people in.
Sure.
So, So why did we talked about this again? But in your sort of in a deeper way, why did you make masks? Why did you take time to make masks? Becky, can you add that as a question? Yeah. Why? Because we care. We do something. A mask 100%. For every face saves lives.
And I want to say, some people, made masks for profit. Some people wanted to fill the gaps in the service industry and they made masks. Some people just really love to sew, and given an opportunity to sew, they will sew a useful, beautiful thing if they can. They love to sew. But a lot of people, because they care, right? Because people need them. It was a caring issue, but, others, might have other reasons, but I think that most people made masks because they care. And they made masks because making masks was a way to protect people who needed it to be useful. All these things are coming up on the feed.
They're just I don't know about you, but I'm just overwhelmed by all of it. I just think it's wonderful,
right? And those of you who toiled in the making of masks, who gave your labor and time and effort, came together and ironed and pleated and stitched to make a homemade piece of personal protective equipment, made masks because you care. And they often weren't made for members of your family or people in your church or even people in your neighborhood. They were made for people all over the world, all over the country. Some of them went to first responders, but some of them just went to people going to the grocery store or elderly people that needed to pick up their medicine. Sewing masks during this pandemic was a way to demonstrate care. And this care was demonstrated not just for immediate family members or community members by the artisan. In a lot of cases, the masks were sewn for unknown persons they didn't even know. And this is because women and femmes have always been engaged with markets of care. Markets of care have pecuniary elements. Of course, to engage in the market of care, you had to buy materials and you had to have thread and elastic. Often you had to buy a bunch of stuff. And your labor has value, but given away. They were just given away. And so much of, to me, the Coronavirus Million Masks Project and this work was done in a market of caring where gifts and donations were the motivating factors, not sales, not money.
And we'll talk about that on Saturday, because we have a 2-day break and we come back on Saturday with a whole new set of panelists. And we'll talk about those that really survived. Our artists survived by selling masks, and that's a totally reasonable, awesome thing. So we'll talk about the community, the economy of mask making that really did save our gig people, all kinds of people that were saved by masks. And so we'll talk more about that on Saturday. We're going to run out. We're going to get kicked out. So, Saru, how do we understand? How
long do I have?
No, it's good. I think around 2:45, we might just all get booted out. So, and we just need a 5-minute wrap up before we leave. So, about 10 minutes. Tell us how to understand. How do we get, we saw the politicalization of masks, right? So we saw, and again, we saw the president not wearing masks. We saw the conservatives saying, oh, I'm not going to wear masks. And it kind of fell apart. We were all together and we were all wearing masks, and then it got politicized. And then the protests so I don't know where we are at this, but we know that everybody wearing masks matters. And we know that the protests are out there and people are helping them with masks and getting masks. And I just don't know what to make of any of it at this point.
So I mean, for me, the act of making masks was a political act. I think that I mean, and I don't think you can remove yourself, in part because, I want to say this. One of my personal heroes, I probably am going to offend some. One of my personal, academic heroes is a woman named Cathy McKinnon, and she's extraordinarily prolific. And I sometimes disagree with her, but one of the big things she says is that women are always cleaning up shit. She says that. Women are always cleaning up shit. Women and femmes are always cleaning up shit, right? And it's a hard reality, right? We clean up shit when they're young and when they're old. I know that's an offensive word. They're always cleaning it up. I feel like, and women are always doing the meal planning and doing the cooking and making sure kids get to the online schooling or get to school and have clothes and get clean. And women and femmes are always cleaning up messes. And I see the act of the 1 million masks as an effort by women and femmes in a time of extreme danger during a global pandemic to clean up a mess that could have been otherwise, right? So what happened was not inevitable. This was a disaster. The way that the pandemic came down was not inevitable. Women and femmes made homemade masks because there was a failure to appropriately engage with the threat, this pandemic, because there was a failure to take coronavirus seriously before it got to the US, because there was a failure to take seriously how vulnerable people were going to be, old people and the elderly were going to be. And
we see, the thing is that we've got to stop talking about the elderly and all. I mean, everybody's getting affected, right?
Absolutely.
The kids that are out in the bars. I want to bring Whitney into the conversation because she has got a lot. She's been on this.
Well, project, I have one more failure. Can I talk about the last failure? Right?
Go for it.
And the biggest failure was we did have personal protective equipment. FEMA didn't do a great job of having this equipment. But the real failure was we failed to have a larger social welfare and support system for the social emergencies of life. Universal health care, paid sick leave, care for the elderly, generous housing assistance, care for workers, right? This is it, right? This was a social failure. This could have been otherwise. Yeah. And that's why it's so political, because it's women and femmes coming in and cleaning up a social failure. And that's, I love your work. I appreciate all the things you did, but it's cleaning up a mess that didn't have to exist.
Yeah. All right. See? All right. Whitney, thoughts? No, can you get it? Yeah.
Yeah, I think that you're definitely expressing an anger that a lot of people who are making masks, organizing, mobilizing are encountering, where it's nobody wants to be making masks. This isn't cute and fun. In actuality, it's because we have to be doing this, or we feel the need to. And like I said earlier, I think that for me, at least, it was just a way to cope with all of the confusion going on around me. And I think that what you're saying about systemic failures in place plays a large role in the pandemic response, because it's we have people in New Orleans, and especially the minority communities and low socioeconomic communities in New Orleans, saying this is this is like Katrina or worse. And I don't think that anybody would be making masks if they didn't feel that way. So I just wanted to ask you to sort of expand on why lower socioeconomic classes and minority communities are really feeling the burden of the pandemic more so than some others.
So, I mean, one of the complicated things is that the burden of the pandemic falls on, kind of two people. There's three people. We talked a little bit about the elderly, but I think that there's two groups. One is people who have pre-existing health conditions are at higher risk for this illness. And pre-existing health conditions also include things like stress. One of the things that's interesting is when you go to medical school, and I'm not a doctor, I'm a law professor, right? We are the different kind of doctor. Yes, are not doctors. But when you go to medical school, there are these classes on stress in medicine. And the classes are basically about how hard it is to be Black or Indigenous, and how the stress of being Black and Indigenous is so bad for people that it literally attacks them at a molecular level, and it makes them sick and it makes them vulnerable. So people who are Black and Indigenous in this country, and I think of people who are Latino, given the way that we work, are because of the structural history of racism, which I could go into, and the stress that goes along with the structural history of racism, have certain pre-existing conditions, but also that stress with the heightened cortisol, it makes them more vulnerable to illness. They're more vulnerable to common cold, to flu, but also more vulnerable to COVID-19, right? So that's one, the people who have pre-existing conditions, and because stress is a factor in relationship to these, a lot of these pre-existing conditions, and because stress, makes people vulnerable to illness, right? Minority communities are going to be deeply impacted. The other prong of that is something we could think about and change. It's who is an essential worker, right? I find it, and this is a footnote, and this is for all of you guys here. It's interesting that this million masks, thing.
And we have lots of groups here, right? We have tons of groups that like
tons
lots
and lots
of
so
like our group
not
is
just
tiny,
million masks, but
right?
people who made masks, the homemade mask community, right? This is at a law school, but not everybody from the law school is here. Why? Because masks have nothing to do with politics, and this is about women sewing, and this is, this isn't about law or whatever, right? Women are sewing because law and politics have failed, period. Women are sewing because you have failed. And if you come and listen to the women who are sewing, you might learn something, right? And it also showed that women who do this hobby for ladies all of a sudden became super essential. All of a sudden became super valuable. Their knowledge and skills became super valuable. And so this is the other thing, the essential workers, right? Who are the essential workers? Low-wage workers who work in retail, in service, who give us food, who take care of our elderly, nurses and orderlies, in addition to doctors, right? But also teachers. There are some daycare center workers. Those workers are disproportionately people of color, empirically, right? Investment bankers are disproportionately white. Male law professors are disproportionately male and white. People who are servers and cooks and childminders are disproportionately people of color. And so I think that that's part of the problem, right? Is we've got this two-pronged problem. But I think that, people who are essential, people who have stress and other pre-existing conditions is why it impacts the minority community so much. But this isn't the only pandemic that impacts the minority community. Part of the problem is that the minority community is already experiencing a pandemic of epic proportion when it comes to racism, economic and social inequality, and the way in which the carceral state has ground down and extracted resources from that community. So the women who founded Black Lives Matter are dealing with the pandemic too. And they're dealing with it from a care response. They're saying, we have tried force, we have tried retribution, we have tried, harsh sentences and criminal injustice. We've tried that. And people are dying. I don't know for other women of color here. I have a feed that's populated by a lot of women of color. Every single day, the police kill somebody on my feed. Every single day, somebody on my feed posts a video of the police killing a Black man or woman. that I watch every day. Every day of my life, there is a new video to watch.
Yeah.
The women activists in the Black Lives Matter protest have said enough. Each person counts. Each person matters. And the response must be care. And so for me, I see the movement to make homemade masks and distribute homemade masks to people is the same animating spirit and the same animating force of care and love and consideration that shapes Black Lives Matter.
I totally love you.
You're allies.
Yes.
You're in solidarity because women have been told their work is not essential, that sewing is not valuable. It's not law. It's not politics, right? Where are my colleagues? Not here. They're not here. Why? Because it's women's work, right? And Black people, Indigenous people have been told they are not valuable, that their lives don't matter, that we can incarcerate you, we can kill you, it doesn't matter. That same animating force underpins what both groups are doing.
Yeah.
And so for me, I think that, the homemade masks, the care that comes from that and the love with which people, made those masks is the same thing that's happening in Black Lives Matter. And it's the same thing that's happening on the streets.
I also have to say, I want to touch on the note where people do say that this isn't gender or race specific, but because we have to say that our summit wasn't even taken very seriously for a while because they thought this is just a woman's thing or woman's craft, and it wasn't taken seriously. Mm-hmm. And so I think that even though men are participating, it is highly gendered. It wasn't like women aren't taken seriously, and that showed all the way through planning and coordinating the summit.
It's true. It's very true.
And this isn't a surprise, and it's because men rule the world. Patricia points out an important point. Like, some men have the hobby of sewing, many men sew. Also, there are many women in power in elected office. But I looked it up. We have one of the most diverse fields of elected officials right now. Women are 51% of the population and 26% of elected officials. White men occupy 65% of elected positions in this country.
Okay, we are going to get kicked out.
So all right, but I just want to say that, I think that it's fair to say this is gendered, and that care work is gendered, and it's already political.
Yeah,
I think you can't say
and when
politics.
we have allies like Seth and others, and they care, and it matters, and it's huge. And we love the men that join and sew and are part of this, but it still is gendered. It's still a gendered issue, and it's very fresh. We care, and I'm proud of caring. Now, we're going to Saru. We're going to switch. So we have 3 minutes before we might get kicked out. Saru, you rock. I know this wasn't what you want to be doing today, and I know this is hard, and I appreciate it because we needed that. We needed your passion, and we needed your super smartness because you are one of the smartest people I've ever met in my whole life on everything. You're just amazing. You blow me away every day when we chat, and you did again today. So I thank you for your words. They are matter, and they're hard words, and they're hard. This is a hard conversation. These are hard words because we don't talk like this. We don't have these kind of conversations out in the world, and I do really appreciate it. And you all in the chat have been so amazing. You've been conversations happening and kindness happening and a really great conversation, and this could have degenerated in ways. This was a risk. Whitney and I are very nervous about this part because we didn't want our day to get to sort of degenerate into sort of upsetness or awfulness, and I think that it wasn't. So I think we're very successful, and they're all thanking you and saying how much they love you, Saru. So I want to say that we have more sponsors to thank on Saturday because we're running out of time. Saturday, we're going to have a ton of fun. We're talking to our keynote or our main conversation is with AccuQuilt and what they did. But we're also talking to costumers. We're talking to artists. We're talking to you guys, the sewists and the quilters. We're talking to the Innocence Project and the lawyers who had to make you'll wait till you hear what happened to their clients and what they had to do to get masks to their clients. It's totally insane. So we continue this conversation. We have another 5 hours. And then after that, we're going to do an incredible preservation project where we show people what we did and also get a best practices out. So we are at 1 minute. We may get kicked out. It may be 3 o'clock, but it may be 2:45. We do not know. So I just wanted to say, just today's been amazing, and I thank you. You all stayed. It was amazing how long everybody stayed. 5 hours of conversation on masks, and we have more on. And Dr. Songer, thank you so much. Everybody's popping back in, and if you're part of our video participants, feel free to come back in. What a day! Just an amazing day. Seriously. All of you, come back in. Amazing. Seriously. Any final comments from anyone? We haven't got kicked out yet. Look at all of you.
This is off topic, but thank you so much to all the panelists for being so cooperative with all of us.
Yes, seriously.
And like, this was such a thing where we planned for like a month, and I like dropped off the face of the earth for a month, and all my friends are like, where did Whitney go? And it was this, and I'm like, now you see what I've been doing. So thank you so much for like working with us and being cooperative and like taking your time to do this.
And I have to say also, thank you to Becky and to all the people that helped, but especially, and to Lex and to Jack, who's not here because he's sick, and Judy and Edith and Gigi and all of the people that helped. But I really, really, really want to thank Hailey, Barnett, and Whitney, who are my 2 law students who I could not do any of this without them. They were beyond spectacular. Tall was awesome. But Whitney and Hailey, man, I mean, seriously, you put your whole heart into this, and you this is because of you guys that we're here. And I just wanted to say, like, power to the students, man. Saru knows. They're amazing. They're just beyond amazing. And I just think you rock my world, seriously. I just can't believe what you all do every day and how you make my job better and you make our world better. So
thank you, Elizabeth.
Yeah. Anyway. Yeah. All right, my darlings. We get to go stretch our legs, eat, join our families again. Also, hope you come back on Saturday. This will also be the recording will be up. We're going to try to get at least the podcast up tonight. We'll see about the video because we're a little bit scared about that, but we'll get that all done. And thank you, everyone. Thank you for the day. It was a great day. And Saru, thank you again. And Dr. Songer, all of you, everybody, thank you so much. Lex, who started this with me, amazing. Thank you. Have a nice night. Thank you again.
Thank you, everybody.
Bye.
Thank you. I learned so much.
Oh, I'm so glad.
Thank you. Join us Saturday.
What time does it start on Saturday? 10?
10 Central again.
Okay, great.
So this was the recording from the first part 1 of the Homemade Mask Virtual Summit. I hope you enjoyed it. Part 2 is on Saturday, and we'll post it after that. And thank you again for listening and being part of this historic summit. So you've been listening to Just Wanna Quilt, a research podcast coming out of Tulane University Law School. And I'm Elizabeth Townsend-Gard. If you like this podcast, keep listening. Also, we have a Facebook group. Come join us. We talk about a lot of things. We also have an Instagram account. And of course, most importantly, I really hope you get a chance to quilt today.